She corrected the surgeon's mistake in front of 30 people, and he had her escorted out of the room like a criminal. 3 minutes later, a man arrived with a bullet wound and a collapsing airway, and every doctor in that ER stood frozen because none of them had ever seen an injury like that outside a combat zone. She walked back in anyway. No one stopped her. And in 4 minutes flat, she did something that shouldn't have been possible, not for a nurse, not in a civilian hospital, not without a surgical team standing by. The man lived, and the room would never be the same. Before we go further, if stories like this hit different for you, if you believe the people who get dismissed the hardest are often the ones carrying the most, subscribe to this channel right now. Hit that like button and drop your city and country in the comments below. I want to see exactly how far this story travels. Don't miss what's coming next, because each story we tell goes deeper than the last. Now, let's get into it. The fluorescent lights inside the emergency department of Callaway Veterans Medical Center had been flickering for 3 days. Nobody had fixed them. That was the kind of place it was functional enough to keep operating. Broken enough that the cracks showed if you looked too long. The hospital sat on the western edge of Doral Springs, a mid-sized city with a large military installation nearby, and its ER handled everything from bar fights to blast injuries, from car accidents to the occasional overdose that nobody wanted to talk about in the morning debrief. On a Tuesday in late November, the night shift was already bleeding into chaos before 9 p.m. The board showed 14 active patients. 3 were critical. One of the trauma bays had a blood pressure cuff that kept reading 60 points too high, which meant the nurses were rotating in and out to manually take vitals, which meant someone was always somewhere they weren't supposed to be, which meant the margin for error was razor thin. Nurse Sloan Mercer had been on her feet for 9 hours. She was 34, quiet in the way that some people mistake for shyness, but was actually disciplined. She wore her dark hair pulled back tight, no jewelry, no nail polish, nothing that could catch on equipment or scratch a patient's skin. Her movements inside the ER were economical. She didn't cross a room unless she had a reason to, didn't speak unless she had something to say, and had learned years ago that the fastest way to survive a shift like this one was to keep her head down and her hands moving. She had also learned years ago that keeping her head down only worked until it didn't. Bay 4 was loud. Dr. Marcus Greer was in the center of it, tall, broad-shouldered, the kind of man who walked into a room and expected it to rearrange itself around him. He had been at Callaway for 11 years, and in 11 years, he had never once been wrong. At least, that was what he believed. His record, his reputation, the framed commendations on his office wall, all of it confirmed what he already knew about himself, which was that he was the best trauma surgeon in the department and possibly in the region. And anyone who questioned his judgment was either ignorant, jealous, or both. He was currently preparing to intubate a 60-year-old patient named Walter Doss, who had come in with respiratory distress and a history of COPD. Sloan had walked in to hang a medication bag and immediately noticed the laryngoscope blade sitting on the tray. She stopped. The blade was a size 3 Macintosh. It was the wrong size. For a patient with Walter's neck anatomy, she'd done his intake, she'd seen his chart, she'd physically assessed him a size 4, would give Greer the angle he needed. A size 3 would almost certainly cause him to oversell the airway, miss his first attempt, and drop the patient's oxygen saturation into dangerous territory while he repositioned. She said it quietly, because she always said things quietly first. Dr. Greer, the blade, I think you want a 4 for this patient. His neck's short, and the landmark's going to be... He didn't even turn around. I didn't ask for your input. I know. I'm just saying the blade size. Mercer. He said her name the way you say a wrong answer. Hang the bag and step out. I don't need commentary from nursing staff during a procedure. There were 6 other people in that bay. A resident, 2 nurses, a respiratory tech, a medical student, who looked like he'd rather be anywhere else. Every single one of them was watching. Sloane stood still for half a second. Then she said, "A size 3 in this patient is going to give you a difficult grade 3 view. I've done his intake assessment. His thyromental distance is short and his neck mobility is limited. I'm not trying to security." Greer raised his voice without raising his eyes from the tray. "Can I get someone to escort this nurse out of my bay?" The word security landed like a slap. The medical student flinched. The resident looked at the floor. Neither of the other nurses moved, because what were they going to do? They had their own jobs, their own precarious standing, their own rent to pay and licenses to protect. A security guard appeared at the doorway within 30 seconds. Sloane didn't argue. She didn't raise her voice. She looked at Walter Doss, old man, frightened eyes, oxygen mask, fogging with each shallow breath, and she set the medication bag on the hook herself before she walked out. In the hallway, she pressed her back against the wall and breathed. Her hands were steady. They were always steady. That was one thing she'd trained out of herself a long time ago, the visible shake, the tell that said, "This got to me." She felt it on the inside, the old familiar burn of being dismissed by someone who should have known better. But her hands were steady and her face was composed, and after 5 seconds she pushed off the wall and went back to her other patients. Behind her, through the thin curtain of Bay 4, she heard Greer attempt the intubation. She heard the suction machine activate. She heard the respiratory tech say, "Tightly, sats are dropping." She kept walking. 40 feet down the hall, she stopped at the nurse's station and pulled up her next patient's chart on the workstation. And she waited. Because she knew what was coming. She'd known it the moment she saw the blade on the tray, and that knowledge sat in her chest like a stone, not satisfaction, not vindication, just the cold, tired weight of being right about something you'd rather have been wrong about. 2 minutes and 20 seconds later, the overhead intercom crackled. "Respiratory team to Bay 4. Respiratory team to Bay 4. Sloane didn't move. Another nurse, Priya Okafor, 5 years on the floor, sharp as anyone in the department, appeared at the station and looked at Sloane with wide eyes. "Wasn't that the intubation Greer was?" "Yes." Did you?" "Yes." Priya pressed her lips together. "He's going to blame you somehow." "Going to try." Sloane minimized the chart window. "What's the status on the patient in 7? She went back to work. In Bay 4, Greer eventually got the tube in with a bougie assist and a repositioned patient, and 4 minutes of everyone in that room holding their collective breath. Walter Doss survived the intubation. His oxygen saturation climbed back up. The crisis passed. Greer emerged from the bay 20 minutes later, looking like a man who had personally defeated something. He stopped in the hallway and made sure Sloane could hear him when he spoke to the charge nurse. "I want it on record that a floor nurse attempted to interfere with a procedure tonight. Unprofessional, disruptive, and frankly dangerous behavior. I'll be filing a formal complaint in the morning." The charge nurse, Doug Felter, tired, political, not interested in picking sides, nodded without committing to anything. Sloane, who was 10 feet away documenting her patient's vitals, did not look up. She just wrote everything down. The time, the blade size she'd recommended, the outcome of the intubation attempt. She wrote it all in the nursing notes, quietly and precisely, because she had learned that lesson a long time ago too. If it isn't documented, it didn't happen. And if it did happen, you'd better be the one who wrote it down first. The shift continued. At 10:47 p.m., the ambulance bay doors opened. 3 things happened simultaneously that told Sloane everything she needed to know before the gurney was even fully inside. First, there were 4 men in civilian clothes running alongside the stretcher, and 2 of them had the particular posture of people who were armed under their jackets, weight slightly forward, arms slightly away from the body, eyes moving in patterns rather than fixing on the patient. Second, one of those men was on a phone speaking in short, flat sentences that didn't sound like panic and didn't sound like grief, and sounded exactly like someone reporting a situation to someone else who needed precise information. Third, the patient on the gurney was wearing what had started as tactical gear and had been partially cut away, and the wound dressing on his left lateral chest was field-applied pressure packed with a hemostatic agent, not hospital gauze, and that was not something a civilian paramedic carried. The paramedic reading off vitals as they came through the door was going fast. Male 41, penetrating trauma, left chest, BP 84/50 and falling, heart rate 132, SATs 88 on 15 liters, diminished breath, sounds left side. Tension pneumo Sloan, said, already moving. The attending on duty that hour was Dr. Nadia Brasso, a competent emergency physician who was excellent with cardiac presentations and decidedly less comfortable with penetrating trauma. She met the gurney in the middle of the bay, looked at the wound, looked at the vitals monitor that was being set up, and reached for her stethoscope. Sloan was already on the patient's left side. She pressed 2 fingers against his neck. The trachea had deviated not much, but enough. His jugular veins were distended. His color was bad. His BP was continuing to fall. The monitor just updated to 79/46. Needle decompression now, Sloan said. Second intercostal space, midclavicular. He's got a tension pneumo. Dr. Brasso looked at the monitor. Looked at the patient. Let me auscultate. First, there's no time to auscultate. Sloan kept her voice flat. Not aggressive. Just certain. His trachea is deviated. His neck veins are up. His pressures crashing, and he came in with a hemostatic field dressing. This is a tension pneumo. If we wait for the stethoscope, his heart arrests. One of the armed men in civilian clothes stepped forward. He was perhaps 45, built like someone who had spent 20 years doing difficult things in bad conditions, and he spoke with the quiet authority of a man who did not raise his voice because he had never needed to. Do what she says. Dr. Brasso looked at him. Sir, you are not authorized to direct medical care. I'm not directing anything. His eyes moved to Sloan. She is, and she's right. Something shifted in the room. Brasso hesitated 1 more second, which was 1 second too many, and Sloan knew it and then reached for the decompression kit. But her hands were uncertain, scanning the tray, and the patient's pressure just dropped again, 71/42. Sloan took the 14-gauge needle from the tray. I've got it, she said. Brasso stepped back half a step. Whether it was trust or shock or simple paralysis, Sloan didn't stop to determine. She located the anatomical landmark with 2 fingers, cleaned the site in a single efficient stroke, and drove the needle in at a 90-degree angle to the chest wall. The hiss was immediate and unmistakable. Trapped air, decompressing. The patient's blood pressure on the monitor began climbing within 30 seconds. Heart rate started coming down from 132. His color shifted not all the way, not yet, but the gray started leaving his face. Chest tube next, Sloan said, and get surgery on the phone. Brasso was already reaching for the phone. The room had reorganized itself around Sloan without anyone explicitly making that decision. She worked fast and she worked clean, doing what needed to be done in the order it needed to be done. And the man on the table who had arrived, looking like someone who had already lost, stabilized enough to be moved to a surgical bay within 12 minutes of coming through the door. When the gurney was rolling out, one of the armed men stayed behind. He was the one who had spoken. He stood at the edge of the now empty trauma bay with his arms at his sides and watched Sloan strip her gloves. You've done that before, he said. It wasn't a question. Needle decompressions are part of advanced nursing practice, she said, without looking at him, especially in a facility adjacent to a military installation. It's not what I mean. She dropped the gloves in the biohazard bin. Is there something I can help you with? The way you assessed him at the door. You identified the injury pattern before you touched him, before the monitor was even running. He paused. That's not nursing school. Sloane turned and looked at him directly for the first time. He had a specific quality, not threatening, not warm, but entirely focused, like a man who had spent years training himself to see things other people missed. His eyes were steady. He was reading her the same way she was reading him, which was an uncomfortable feeling, and one she hadn't experienced in a long time. Patient is stable, she said. That's what matters. His name is Commander Declan Voss. He let the name land, watched her face. Does that mean anything to you? Kept her expression neutral. I don't know the patient's name. I know his injuries. Right now, that's my job. He served in MSOC operations out of the Pacific Theater. Classified assignments, 2014 through 2020. Another pause. Any of that sound familiar? The trauma bay was empty except for the two of them. The fluorescent light above the third cabinet was still flickering. It had been flickering all week. Nobody had fixed it, and in the erratic light, his face was impossible to read precisely. Speak with hospital administration, Sloane said, if you have questions about the patient's care. I'm not asking about his care. He pulled something from his jacket pocket. Credentials wallet. He opened it and held it at a distance that was respectful but visible. Defense Intelligence, Special Operations Support. My name is Agent Cass Harmon. He closed the wallet. And I think you know exactly who Commander Voss is. I think you've known since the moment that Gurney came through the door. Sloane looked at the credentials, looked at Harmon, looked at the door. I have other patients, she said. She walked out. The next hour was controlled chaos of the standard variety, 2 more ambulance arrivals. A patient in Bay 9 who pulled his IV and needed to be talked back down. Priya calling for backup on a combative patient in the waiting area. Sloane moved through all of it the way she always did, efficiently and without drawing attention to herself, checking boxes on her mental list the way she had been checking boxes since she was 22 years old. And someone first handed her a medical kit in a situation where there was absolutely no room for error. She did not think about Declan Voss. She did not think about the Pacific Theater, or 2014, or what Harmon's eyes had looked like when he said the name. She thought about the patient in Bay 3, whose potassium levels needed rechecking, and the patient in Bay 7, whose pain management wasn't working, and the IV in Bay 9 that needed a new line before the shift was over. She was good at this, the compartmentalization. She had built it the way you build anything under pressure, out of necessity, reinforced over time until the structure became load-bearing. At 12:15 a.m., Dr. Marcus Greer appeared at the nurse's station. He had no reason to be there. He'd been working upstairs, but he had clearly heard about the trauma bay situation because the particular look on his face was the one he wore when something had happened that he felt should have involved him. He looked at Sloane. I heard there was a penetrating trauma case. Military patient. Patients in surgery, she said, without looking up from her charting. And you were the primary? I assisted attending. Brasso. He said the name with a very specific kind of dismissal. Right. He leaned one hand on the counter. You realize a needle decompression performed outside surgical supervision is a liability issue. It's within the advanced practice scope for an RN in an emergency setting with an unstable patient. I documented everything. You documented. He repeated it like it was funny. You know, for someone who's been trying to stay out of trouble tonight, you're doing a remarkable job of the opposite. She looked up at him then, just for a moment. Just long enough for him to see that she wasn't afraid of him, which was the thing he couldn't stand about her, that no matter what he said, no matter how he came at her, she looked at him with the same calm, steady attention that he found infuriating, precisely because he couldn't identify what was behind it. I have patience, she said. Yeah, he straightened up. I'll be speaking with the chief of medicine in the morning. Tonight, all of it. He gestured vaguely, which meant he was including the Bay 4 incident, the trauma case, and probably whatever else he could think of before the sun came up. You should be thinking about whether you want to continue practicing here. He left. Priya appeared at Sloane's elbow 30 seconds later. Can't actually fire you. He's a surgeon, not administration. He can make the case to someone who can. Sloane turned back to her screen. I know. Are you worried? A beat. Honest answer, some. Realistic answer, yes. Because Greer had been at this hospital for 11 years and had the chief's phone number in his personal contacts and had successfully gotten 2 nurses reassigned in the last 4 years for reasons that had very little to do with competence. Not right now, she said. Right now, I'm worried about the patient in 3 whose potassium is trending down. Priya looked at her for a long moment. Where did you learn to do that? The chest thing. The way you just looked at the patient and knew. Sloane thought about how to answer that. She thought about a lot of things in the space of that second, about the question itself and what it would take to answer it, honestly, and about the fact that Harmon had asked her essentially the same question 2 hours ago. And she had deflected it then, and she was going to deflect it now, because some doors, once you open them, don't close again. Experience, she said, and she went back to work. 9 a.m., everything changed. Sloane was in the supply room, pulling replacement dressings, when she heard the rapid overhead announcement, not the standard intercom, but the coded announcement that the ER used for security situations. 2 nurses moved fast past the supply room doorway in the direction of the main corridor. Sloane heard boots on the linoleum. Not hospital soft, not the rubber soles of medical staff. Hard-soled, heavy. She stepped into the hallway. 3 men she had never seen before were moving through the ER with focus that had nothing to do with seeking care. They were dressed in civilian clothes, gray, nondescript, the kind of clothing specifically chosen to not stand out. They were moving with coordinated purpose, and one of them had his right hand resting near his hip in a way that Sloane recognized. They were heading toward the surgical corridor, where Declan Voss was. Her mind ran the calculation in under a second. Harmon had told her Voss was carrying something classified. The way Harmon's team had been positioned around the gurney, the way one of them had stayed behind while the others went with the patient they'd been watching the entry points. But these men had come in through the ER, which meant they knew the layout, which meant they had done reconnaissance, which meant this was not improvised. Pulled out her phone and called Harmon's number. He had given her a card. She had told herself she wasn't going to use it, and she had put it in her badge pocket anyway, and she was not going to think about what that said about her right now. Picked up on the first ring. 3 men, she said, moving through the ER towards the surgical corridor. They're armed. They know where they're going. A half-second pause. Then, where are you? Main hallway, outside the supply room. East side. Stay there. 2 patients in the post-procedure bay between them and Voss Minus. Mercer. His voice was sharp and quiet at once. Stay where you are. She hung up. She did not stay where she was. She moved in the opposite direction from the 3 men, not toward them, not yet, but in a parallel track through the staff corridor that ran alongside the main hallway and connected to the post-procedure bay from the west entrance. She moved quickly and quietly, the way she had learned to move a long time ago, in places where moving loudly got people killed. The post-procedure bay had 4 patients. All of them were post-surgical and sedated or semi-sedated. A night shift tech named Reuben was doing rounds. Sloane appeared in the west doorway. Reuben, take the patients in 2 and 3 through the internal door to the recovery annex. Right now. Don't ask me why. He looked at her face. He had worked with Sloane for 2 years and had never seen her face look quite like this. Not panicked. Nothing like that, but switched into something more fundamental. Did not ask why. Yeah, he said, okay. He started moving. Sloane stepped back into the staff corridor and waited. She could hear the 3 men in the main hallway. Their footsteps had that quality of people trying to move quickly while still seeming like they belonged there. And the seam between those 2 things, created a rhythm that was wrong enough to notice if you knew what you were listening for. She heard Harmon's team before she saw them radio crackle. Fast movement from the east end of the building. She heard someone shout something that might have been a command or an identification, and then she heard the unmistakable sound of a situation that was no longer pretending to be anything other than what it was. In the post-procedure bay, one of the sedated patients stirred. A monitor alarm chirped. Sloane was already inside the bay, at the bedside, silencing the alarm before it cascaded and before the sound drew the wrong people toward the right room. She stood in the dim light of the bay, between the patients and the door, with her hands at her sides and her eyes on the east entrance. And she waited to see which direction the threat was going to come from first. The hallway outside went quiet. Then it got very loud. East door of the post-procedure bay banged open hard, fast, and one of the three men came through it, moving at a dead run, and he was not looking at the patients. He was looking toward the surgical corridor beyond. And he stopped when he saw Sloane standing in his path. He had a weapon half drawn. She was a nurse in blue scrubs, standing still, hands visible. He hesitated. That was his mistake. Because what she did next took approximately 1.4 seconds and involved no raised voice, no visible effort, and an application of physics and leverage that someone had taught her in a facility that did not officially exist, in a program she had not officially been part of, in a year that she had spent a considerable amount of effort trying to put behind her. The man was on the floor. His weapon was not in his hand anymore. Sloane straightened up. Harmon came through the door 3 seconds later with two of his people and assessed the scene in a single sweep. He looked at the man on the floor, looked at Sloane, looked at the patients still sedated, still monitored, nothing disturbed except the east door. "You were supposed to stay in the corridor," he said. "There were patients in here," she said. He looked at her for a long moment. Behind him, his team was securing the man on the floor and speaking into radios. Hypotics. Down the hall, she could hear the sounds of the situations resolving more rapidly than she would have expected, which meant Harmon had more people in the building than she'd seen at the ambulance bay. "Mercer," Harmon said. She turned to check the monitor on the patient nearest to her vitals. Steady, alarm silence holding. Nothing compromised. "Sloane." He used her first name this time. She turned back. His face had changed. The focused assessment quality was still there, but underneath it was something else, something that looked a lot like the expression of someone who has confirmed a thing they already suspected and is not entirely sure how to proceed with the confirmation. "I need you to come with me," he said. "I'm on shift." "I know." He glanced at his watch. "Voss is out of surgery. He's asking for you. The supply room. The potassium levels in Bay 3. Complaint Greer was going to file in the morning. IV line in Bay 9 that still needed replacement." All of it organized in her mind like a map of obligations, and she moved through it the way she always moved through difficult things, quickly without the luxury of pretending the difficult thing wasn't there. "A patient asking for me is not unusual," she said. "He's not asking for the nurse who saved him." Harmon's eyes were steady. "He's asking for Mercer, by name, by full name." A pause. "He says he owes her one from Karwan province." The name landed in the room like a stone dropped into still water. Karwan province. She hadn't heard that name spoken out loud in 6 years. She had heard it in her own head, in the dark, more times than she could count. Had heard it the way you hear something that reshapes the interior of a place, not loudly, not all at once, but persistently, until the shape of you is permanently different. Sloane kept her face still. But Harmon was very good at his job, and the stillness itself told him what he needed to know. "Thought so," he said quietly. Outside the bay, the ER continued its ordinary chaos monitors alarming, voices calling down hallways, the sound of a hospital doing what hospitals do. And inside the bay, in the pause between everything Sloan Mercer had spent 6 years building and everything that had just walked back through the door, she stood between the patients and whatever came next. And for the first time in a very long time, she didn't know what move came after this one. The name sat between them, like something physical. Harmon didn't push. He was patient in the way that people who have done difficult work for a long time learn to be patient, not passive, not uninterested, just willing to let a silence do the work that words couldn't. He stood in the dim light of the post-procedure bay with his arms at his sides, while his team handled the man on the floor behind him, and he watched Sloan Mercer decide something. She didn't take long. 5 minutes, she said. Then I'm back on shift. He nodded once, like that was reasonable, and led her out. The surgical recovery suite on the second floor was quieter than the ER, the particular quiet of a floor where everyone was either sedated or too exhausted to speak, where the loudest sounds were the rhythmic compression of IV pumps and the low electronic hum of monitoring equipment. 2 of Harmon's people were stationed in the hallway outside a room at the end of the corridor, and a third was inside, standing near the window with his back to the wall. Commander Declan Voss was awake. He looked like a man who had been put through something serious and had come out the other side, still in possession of himself. Was a specific quality Sloan recognized because she had seen it before in people who had trained themselves to survive bad outcomes. He was pale and his left side was bound, and he had an oxygen line running under his nose, but his eyes were clear and tracking, and when Sloan came through the door, they found her immediately. Studied her face for a moment. "You cut your hair," he said. "You got shot," she said. Something moved through his expression, not quite a smile, not quite relief, something more complicated than either. "Fair," he said. Harmon closed the door behind them and stayed near it. Sloan moved to the bedside rail, not sitting, not settling in, making clear this was professional proximity and not a reunion, and looked at the monitor. Pressure was holding. His oxygen saturation was back in the normal range. The surgical team had done what needed doing, and the chest tube was draining correctly, and he would probably be fine, assuming the next 12 hours cooperated. "How bad is it really?" he said. It wasn't a question about his own condition. The pneumo's resolved. The bleeding was controlled in surgery. You'll be in significant pain for several weeks, and your left lung capacity is going to be reduced for a while. But you're stable. Not what I meant. She looked at him. "The situation," he said. "How bad is it out there, right now?" Harmon answered before she could. 3 hostiles neutralized. 2 in custody, 1 managed to exit the building before we locked it down. We have teams working the perimeter. 1 got out. Voss processed that. He'll report back. Yes. So we have maybe 4 hours before they regroup and try something else. He shifted against the pillow and controlled the resulting pain with the practiced efficiency of someone who had been hurt before and knew that making noise about it wasn't useful. "I need to talk to you," he said to Sloan. "Not about the medical situation." "I know," she said. "Karwan province. I heard you the first time." "Then you know what I'm carrying." He watched her face. "And you know why they want it." She did know. She had known the moment Harmon said the name, had felt the entire shape of it settle into place the way a dislocated joint settles when it's put back painful and necessary and leaving things different than they were before. Karwan province was not just a place. It was an event. A specific event in a specific year in which several things had happened that were supposed to stay buried, and someone somewhere had clearly decided that Declan Voss represented a threat to that burial. "I left," she said. "I walked away from all of it." "I know you did. I built something here. 6 years." "I know that too." He held her gaze. "I'm not here to pull you back in. I didn't come to Doral Springs because of you. I came here because Callaway is the closest cleared facility to where my team was operating, and I had a hole in my chest and limited options." A pause. "Fact that you're here, that's either the worst luck or the best luck, and I haven't decided which yet." How did you know my name? My real name. Because I was the one who read your after-action reports from the Karwan mission, he said quietly. Before everything went sideways, I read all of them. You were the only one who documented everything correctly. The only one whose records were complete. He stopped. When they started trying to make the mission disappear, your file was the first one they went after. The room was very still. Sloane had known, in the abstract, that her file had been altered. She had known it the way you know something you've been told without being shown the evidence, not disbelieving it, just not fully certain. Hearing it said plainly by someone who had been there on the institutional end of it landed differently. What are you carrying? She said. Original documentation. Pre-alteration. Medical records, mission logs, communication intercepts. Everything that proves what actually happened in Karwan province and who made the decisions that got 4 people killed. His jaw set. And who spent the last 6 years covering it up. Sloane stood there and let that land. Behind her, Harmon was quiet. Outside the room, the hospital continued its low-frequency hum IV pumps, distant monitors, a PA announcement about a staff meeting that nobody in this room was going to attend. The normal world insisting on itself. She had spent 6 years building her corner of it. The ER, the patients, the particular rhythm of a night shift, the satisfaction of a good outcome, and the weight of a bad one. It wasn't glamorous, and it wasn't protected, and it paid badly, but it was real in the way that mattered to her tangibly, physically real, stakes she could see and touch and document. She had not told anyone here who she used to be. Not Priya, not the charge nurse, not anyone. Not because she was ashamed of it, but because she was tired in the specific way a person who had been trained to operate at a level that cost more than it returned, and who made a deliberate decision to step down from that cost. And now Declan Voss was lying in a hospital bed with a chest tube and a data package that could blow open a 6-year-old cover-up. And someone had sent at least 3 armed people into a civilian hospital to stop him. I'm a nurse, she said. You're a nurse who just put a trained operative on the floor in under 2 seconds, Harmon said from the door. With an empty-hand technique from a program that hasn't officially existed since 2019. She didn't turn around. I work in an ER adjacent to a military installation. Taken self-defense courses. Sloane. Voss said it, the way Harmon had said it downstairs first name. Quiet, direct. I'm not asking you to come back. I'm not asking you to do anything tonight, except understands what's at stake. People whose names are in this documentation, they are still operational, still in positions of authority. And they know that the one file they couldn't fully sanitize belonged to a combat medic who documented everything and then disappeared. He looked at her steadily. They don't know where you went. But if the operative who got out tonight saw your face, he saw my face, she said, then you're already in this. She looked at the monitor, looked at the chest tube drainage, looked at Declan Voss's face, which was the face of a man telling her a true thing she didn't want to hear. Get some rest, she said. Don't move the chest tube. Call the nurse's station if your breathing changes. She looked at Harmon. I need to get back to my shift. She walked out before either of them could say anything else. The ER at 3 a.m. had settled into its between-hours rhythm, not slow exactly, never actually slow, but operating at a lower frequency than the peak hours, the kind of pace where you could think if you let yourself, which was exactly what Sloane was trying not to do. She changed the IV line in Bay 9. She rechecked the potassium levels in Bay 3 and called the on-call physician with the results and documented the interaction. She helped Priya manage a patient in the waiting area who had developed a new complaint since arriving 4 hours ago and was escalating toward a scene. She did all of it with the same competence and economy of motion she always brought, and underneath it, like a frequency running at the edge of audible range, she processed everything Voss had told her. She was still processing it at 4:15 a.m., when Dr. Marcus Greer appeared on the floor. He had no shift obligations at this hour. He was in his street clothes, which meant he had come in specifically, which meant someone had called him, which meant whatever was happening upstairs with Voss and Harmon had leaked sideways into the hospital's political structures faster than she had anticipated. He found her at the nurse's station and stood on the other side of the counter in a way that was specifically designed to communicate that the counter was a boundary he was not going to cross. The chief's office called me at home, he said. I'm sorry to hear that. The security incident tonight. The military patient. You were involved in both. I was on shift. Yes. That's not what I mean, and you know it. He's set both hands flat on the counter. What happened in that procedure bay? The report from security says there was an altercation. A man was injured, and you were present. I was protecting the patients in the post-procedure bay during a security situation. Hospital security and the federal agents on site handled the altercation. Federal agents. He repeated it with a specific emphasis, like the words were more significant than their face value. What kind of nurse has federal agents vouching for her conduct at 4 in the morning? Kind who does her job when things go sideways, Priya said from 6 feet away, not looking up from her workstation. Greer's attention shifted briefly to Priya and then back. I'll be honest with you, Mercer. I've been at this hospital 11 years. I've seen nurses come and go. I've seen the kind of trouble that follows certain people. And I've seen the kind that doesn't. What I'm looking at right now, he gestured vaguely toward the second floor, or toward the night in general. This is the kind that doesn't go away quiet. Sloan looked at him. Is there a medical question I can help you with, Doctor? Greer? His jaw tightened. I'm filing the formal complaint in the morning. Bay 4, the intubation, your conduct during the procedure. I'm also flagging tonight's incident as part of a pattern. The chief will review it. That's your prerogative. She turned back to her workstation. Psychologically, professionally, I'll make sure my documentation is complete. He stood there a moment longer, and she could feel him deciding whether to say something else, something that would establish dominance in a way that her calm kept denying him. And then he didn't, because there was nothing to say to a person who was simply going to keep working. And he left. Priya waited until his footsteps faded down the hall. He's actually going to try to get you fired. She said it quietly, not dramatically. Tonight, I know. Is there anything? Not right now. Sloan stared at her screen. Let me just finish this shift. Priya looked at her for a long moment with the expression of someone who has things to say and the wisdom to not say them. Then she went back to her work. At 5:40 a.m., 20 minutes before the day shift would start arriving, Harmon found her in the break room. She was standing at the coffee machine, not sitting, not settled, just standing with a paper cup, warming her hands, and she had been standing there for 4 minutes, thinking about nothing specific, which was the closest thing to rest she'd had all night. He came in and closed the door and didn't go for the coffee. The operative who got out, he said. We identified him from building cameras. He's connected to a private intelligence contractor out of Northern Virginia. The same contractor that has been systematically acquiring former MSOC personnel since 2021. Turned the cup in her hands. How many people does this contractor work for? That's the question. He moved to the table, but didn't sit, mirroring her preference to stay standing. The documentation Voss is carrying, if it becomes public record, it implicates 3 current senior figures. 1 in the civilian intelligence apparatus, 2 in the military command structure. All of them with the resources and motivation to make sure it never reaches a court. He needs to be moved, she said. We're working on it. There's a secured federal facility 40 miles north. We're arranging transport, but it needs to be coordinated through channels that won't tip off the people we're trying to keep Voss away from. He paused. That takes time we may not have. You said 4 hours. I said maybe 4 hours. It's been 3. She drank the coffee. Too hot and too strong, and she drank it anyway. What do you need from me? It wasn't quite a question. Harmon looked at her with an expression that was up direct without being demanding. Nothing you're not already doing. Stay on shift. Be visible. If they're watching the hospital and they are your presence in the ER, keeps the pattern normal. And if they come back, then we need someone inside who knows how to read the situation before it becomes a situation. He met her eyes. You proved last night that you can do that. I'm a nurse, she said for the second time in 2 hours. I know. He didn't argue it, and Voss is alive because of it. Those two things aren't mutually exclusive. She set the cup down. If I see something, I'll call you. That's all I'm asking. She moved toward the door. He stepped aside. She stopped with her hand on the door handle and said, without turning, the documentation. Pre-alteration records. If they get out, what happens to the people who are still living with what Karwan cost them? A moment of silence. Depends on what you mean by happens, he said carefully. I mean, the ones who lost people. The ones whose records were changed without their knowledge. The ones who've been carrying a version of events that was specifically designed to protect the people in power. She paused. Does it give them anything back? It gives them the truth, Harmon said. Whether that's enough, that's not something I can answer. She pushed the door open and walked out. The day shift arrived at 6 a.m. In the regular progression of scrubs and coffee cups and too early conversation, and Sloane gave her handoff report to the oncoming nurse with the same precise economy she always used: patient status, pending labs, outstanding orders. Anything that needed immediate attention flagged and transferred. She did not mention the second-floor situation. That was Harmon's department. What she did mention, quietly and specifically to the charge nurse before she left, was that the patient in Bay 4's overnight documentation should be reviewed, and that she had flagged a concern about the intubation outcome in the nursing notes. She said it without emphasis, in the same tone she would use to mention a lab value, and the charge nurse, Gloria Tesh, experienced and unflappable, wrote it down without reacting. Sloane changed out of her scrubs in the locker room and put on her street clothes, jeans, gray pullover, the worn running shoes she wore home, and shouldered her bag and walked out through the staff exit into a morning that was pale and cold, kind of November morning where the sky couldn't quite commit to a color. She got to her car. She sat in it for a moment without starting it. Karwan Province. The name was out now, in the air, said out loud, no longer containable in the part of her where she kept the things she didn't look at directly. 6 years of building something small and clean and hers, and in the space of one night shift, it had all been located, not taken. Not destroyed yet, but located, which was the first step toward both of those things. She thought about Walter Doss in Bay 4, frightened eyes behind the oxygen masks, and how she had seen the wrong blade on the tray and said something about it because she couldn't not say something. She thought about Declan Voss coming through the ambulance bay doors, with a collapsing chest and a field dressing and 4 armed men who weren't paramedics, and how she had known what to do before she'd consciously decided to do it. She thought about the man who had come through the post-procedure bay door with a weapon half drawn and had hesitated when he saw a nurse in blue scrub, and she thought about what that hesitation had cost him and what it had protected. She started the car. She was going home. She was going to sleep for as long as she could manage, which probably wasn't long. And then she was going to decide what came next. That was the plan. She was 3 blocks from the hospital when her phone rang. Harmon, she answered on the second ring. What? We have a problem. His voice was flat in the specific way that meant the problem was real and immediate. The operative who exited the building last night, we found him 40 minutes ago on a residential street 2 miles north of the hospital. She waited. He didn't run, Harmon said. He was there because he was setting something up. We found a package addressed to the Callaway administration. Physical package, courier delivered, timed for 7 a.m. What was in it? A dossier. A beat on you. Your real name, your military record, the real one, not the sanitized version, your current employment status. And a set of allegations specifically constructed to destroy your nursing license and your credibility before you can say anything that could be used to corroborate Voss. The car was still moving. She was driving on muscle memory while her brain worked the situation. They're not just trying to stop Voss, she said. No. Harmon's voice was careful. They're trying to eliminate every potential witness who can verify what the documentation says. And you, whether you meant to be or not, you are the one witness they cannot afford to have standing. Pulled to the curb, the pale November morning was very still outside the car windows. A neighborhood she drove through every day, 2 blocks from a bakery she liked, 4 blocks from the dry cleaner, where she'd dropped something off last Thursday. Ordinary geography of a life she had built, specifically to be ordinary, specifically to be undramatic, specifically to be the opposite of what 6 years ago had cost her. The dossier, she said. Is it already with the administration? Our people intercepted it, but they know we would try to intercept it, which means they'll find another way to get the information to the hospital. He paused. And to anyone else who might be inclined to act on it. The medical licensing board, local press, anyone who can be used to take you off the board before noon. She looked at her hands on the steering wheel. For a moment, just a moment, brief and honest, she felt the specific weight of it. 6 years. All of it built carefully, stone by stone, out of something that had nearly buried her. Not a perfect life, a real one. And now someone in an office somewhere, behind a desk she would never see, had decided to take it apart in order to stay safe. The moment passed. I'm coming back to the hospital, she said. Sloan, if they're going to make a move against my credibility, they need me somewhere they can control the narrative. If I'm visible, if I'm working, if the staff and administration see me functioning at the same level they've seen for 6 years, she thought it through as she spoke. Then the dossier lands on someone who has direct evidence that contradicts whatever it says. Ian Tritzes. Or at least direct recent evidence. Silence. That's not a bad read, Harmon said slowly. Also, she said, if I'm in the building, I can see what's coming. There's a third option they might try. His voice dropped slightly. Contractor doesn't just operate with intelligence. When information containment fails, they move to the next tool. She understood what he was saying. I know, she said. Are you sure you want to? Come back in. She looked at the pale sky through the windshield. Thought about Ruben moving the patients to the recovery annex without asking why, because he'd looked at her face and trusted what he saw there. Thought about Priya saying he can't actually fire you with enough conviction that it almost sounded true. Thought about Walter Doss and his frightened eyes, and the size 3 blade, and the fact that she had said something because she couldn't not say something, and that had been true her entire life, and running from it hadn't changed it. I'm already turning around, she said. She pulled back into traffic and drove toward the hospital, and as she drove, her phone buzzed with a text from a number she didn't recognize. Checked it at the next red light. It was a photograph, taken from a distance slightly blurred by zoom. The parking lot of Callaway Veterans Medical Center. The staff entrance, and standing outside it, clearly waiting, were 2 men in civilian clothes that she recognized not their faces. Their posture, the same wrongness of movement she'd identified 12 hours ago in the ER hallway. Beneath the photograph, 1 line of text. We know you're coming back. So are we. The light turned green. She put the phone on the seat beside her and drove. She didn't call Harmon back. She pulled into the hospital parking structure from the north entrance, not the staff lot, not the one in the photograph, and took the elevator to the 3rd floor of the structure and walked the sky bridge into the hospital's administrative wing, which connected to the main building through a corridor that bypassed the staff entrance entirely. It added 4 minutes. It meant the 2 men waiting at the staff entrance were watching the wrong door. She used those 4 minutes to think. The dossier was the first move. The men at the entrance were the second. Both happened before 7 a, which meant the timeline was compressed. Whoever was running this operation had decided that the window for clean containment was closing and had accelerated to the next phase. That was not a sign of control. That was a sign of pressure. Someone on their side was feeling the urgency, which meant Harmon's people had done something overnight that was working, which meant the documentation Voss Way was carrying was closer to becoming actionable than the other side could comfortably manage. Accelerated timelines meant mistakes. She pushed through the administrative wing door into the main corridor and pulled out her phone. She texted Harmon, came in through admin Skybridge. 2 men at staff entrance, are they yours? The reply came in under 30 seconds. No. She kept moving. The second floor was already active with early day shift staff. She went to the locker room, changed back into her scrubs. She had a spare set in her locker, always had, a habit from years of being called back in, and clipped her badge and walked out onto the floor like she had never left. Priya was at the station doing a crossover check with the night chart. She looked up when Sloan appeared and something moved through her expression, surprise, then relief, then the specific look of someone deciding not to ask the obvious question out loud. "You're back," she said. Couldn't sleep. Sloan scanned the board. "What's the status on the patient in 7? Priya took one more second to study her. Then she turned back to the chart. Potassium is normalized. Cardiologist came down at 6, reviewed the rhythm strips. She's being admitted upstairs. Good. Bay 4, Walter Doss is being transferred to the pulmonary unit this morning. He's stable. Who's the attending on now? Dr. Lena Farrow until noon, then Greer comes on at 12:30. Sloan processed that. Greer at 12:30. She had until then to establish a day that was entirely, visibly, documentably normal. Every patient interaction logged, every order confirmed, every communication, professional and recorded. If the dossier arrived through another channel, if someone from licensing called, if the administration brought her in, she needed 6 hours of clean, unimpeachable documentation to point to. She went to work. At 8:14 a.m., she was in Bay 2 assessing a 30-year-old with a suspected radial fracture when her phone buzzed against her hip. She finished the assessment, documented her findings, and ordered imaging before she checked the message. It was from a number she didn't have saved. Not the same number as the photograph. Different. Floor 2, room 214. He's asking for you again. Harmon. Different phone. She finished the imaging order and went upstairs. Voss was sitting up. Someone had brought him a hospital breakfast tray that he hadn't touched, and the morning light coming through the window gave the room a quality of normalcy that was completely at odds with what had happened in it 8 hours ago. One of Harmon's people was still by the window. Harmon himself was standing near the door. Third person in the room was someone Sloan hadn't seen before. She was perhaps 55, short-haired, wearing civilian clothes that were the specific brand of nondescript that suggested someone who had spent a career not being noticed. She had a tablet in her hand and the unhurried posture of someone with institutional authority who didn't need to perform it. "Nurse Mercer," the woman said. Not a question. She'd been told. "Who are you?" Sloan said. Deputy Director Annette Sorrell. Defense Intelligence. She held the tablet briefly toward Sloan credentials on the screen. Official, stamped. "I flew in from D.C. at 2 this morning." Sloan looked at the credentials. Looked at Harmon. He gave her nothing, which meant this was real, and he was letting her process it herself. "What do you need from me?" Sloan said. "Sit down, please." "I'd rather stand." Sorrell, accept that. "We've been tracking the contractor for 14 months. The operation you witnessed last night, the attempt on Commander Voss, it confirmed our final gap in the evidentiary chain, which is why the people behind it are panicking." She paused. "The dossier they built against you, we've seen iterations of it before. They use the same structure every time. Target someone adjacent to the primary witness, build a narrative that discredits them before they can speak, then use that discrediting to poison the evidentiary well. She held Sloane's gaze. You are not the first person they've done this to. Who else? Sloane said. Sorrel looked at her tablet. 2 of the other surviving members of the Karwan mission. Both had their records altered within 6 months of the incident. One lost his security clearance in 2020, based on a manufactured psychological evaluation. One was discharged under circumstances that have since been flagged as procedurally irregular. A beat. A third left active service and dropped out of traceable contact. Until last night. The room was quiet for a moment. Voss was watching Sloane from the bed. He looked like a man who had been carrying something heavy for a long time and had arrived at the place where he might be able to put it down, but wasn't sure yet if the ground was solid enough. The documentation I'm carrying, he said, has the original mission logs. Unaltered. It has the communications that show who gave the order that put us in that valley without proper intelligence. And it has the original after-action medical records. He paused. Your after-action medical records. The ones that show what you actually did, how many casualties there actually were, and what the real cause of death was for the 4 soldiers who didn't come home. Sloane's hands were at her sides. Steady, as always. On the inside, not steady. Not the way she'd been not steady last night, which was the manageable operational kind. This was older. This was the original version. Those records were altered, she said. Flat. Certain. The versions in the official file were, yes. Voss met her eyes. The originals are in the package. How? Because you weren't the only one who kept copies. He held her gaze. I kept mine. I kept everything. From the moment I realized what was happening. It took me 6 years to get to a position where I could do anything with it. Sorrel stepped forward slightly. Nurse Mercer, we are prepared to move on the individuals named in this documentation. We have a federal judge's authorization. We have a secure federal witness framework. But the evidentiary chain requires corroboration of the original medical records by the person who created them. She paused. That's you. The hospital mourning went on around them. Somewhere on this floor, someone was being prepped for discharge. Somewhere downstairs, a new patient was coming through the ER doors. The ordinary machinery of a place built to keep people alive, moving in its ordinary way, indifferent to the fact that a woman was standing in room 214 being handed the exact thing she had walked away from 6 years ago. If I corroborate, she said slowly, the people behind this, the contractor, the 3 names in Voss's documentation, they already know I'm a threat. They're already moving against me. Yes, Sorrel said. So there's no version of this where I walk back to the ER and resume normal operations, and this goes away. No. Sorrel didn't soften it. That version ended when they identified you last night. Sloane looked at Voss. You knew this would happen. When they brought you here. I didn't know you were here, he said again, and she believed him. But yes, I knew when they identified me in transit that whoever was at the receiving facility would become a target if they had any connection to the mission. He held her gaze. I'm sorry, for what it's worth. It was worth something. Not everything, but something. What do you need from me right now? She said. To Sorrel, practical, specific. A formal statement. Recorded. Corroborating the original medical records. How long? 2 hours if we're efficient. I have patients downstairs. Can arrange coverage. Sloane thought about Greer arriving at 12:30. The dossier and the men at the staff entrance and the text with the photograph. About Walter Doss's potassium levels normalizing and the woman in Bay 7 being admitted upstairs and the fractured radius she'd just sent to imaging. She thought about 4 soldiers who didn't come home from a valley in Karwan province and whose families had been handed a version of events specifically designed to protect the people responsible. 2 hours, she said. Then I go back to my shift. Statement took 2 hours and 11 minutes. Sorrel was meticulous and Sloane was precise, and the intersection of those two qualities produced something that was neither comfortable nor fast, but was thorough in the way that things need to be thorough when they're going to be used in a federal proceeding. Sloane spoke from memory. She had good memory. Always had. Better than she sometimes wished, and she confirmed specific entries in the original records that Voss's documentation contained, and she described the events of the Karwan mission in the sequence in which they had occurred, without interpretation, without editorializing, just the clinical and operational facts as she had documented them at the time. It was not the worst 2 hours of her life. It wasn't even close. But it had a specific cost, the particular exhaustion of speaking about something you have kept compressed for a long time, and the way that speaking about it at length makes the compression permanent. She was done by 10:22 a.m. Sorel reviewed the recording and said, "This is sufficient for our purposes. We'll be moving to formal proceedings this afternoon." How long before the named individuals know? They may already suspect. The contractor's timeline compression suggests they're aware our case is consolidating. Sorel looked up from the tablet. Brings me to the next problem. Sloane had been waiting for the next problem. The two men at your staff entrance this morning were confirmed contractor assets. We tracked them to a vehicle registered to a shell company with ties to the same network. Sorel set the tablet down. They left the entrance at 8:50 a.m. We don't know where they went. Into the building, Sloane said. Sorel's expression didn't change, but something behind it did. We don't have confirmation of that. They were watching the entrance. I didn't come through it. They waited long enough to confirm I hadn't used it, which means they eventually concluded I was already inside. She looked at Harmon. How many access points does this building have? 14, including loading docks and service entrances. He was already on his radio. How many does your team have covered? A beat. 8. The other 6? She already knew the answer. His jaw set. Working on it. She pulled out her phone and called the charge nurse downstairs, Menjik. Gloria. Who's currently on the floor? Priya, Kevin, and 2 travelers. Why? How many patients? 11 active, 4 in fast track. What's going on? I need you to pull everyone away from the exterior bays and consolidate in the central corridor. Any patient who can be safely moved, move them toward the interior. Tell them it's an equipment issue. Silence. Gloria Tesh was not a person who panicked, which was why Sloane was talking to her. How serious, precautionary, but don't take long. Give me 10 minutes. You have 5. She hung up and looked at Harmon. We need to get Voss out of this building. Transport isn't ready. Transport needs to be ready in 20 minutes, or it needs to not be the plan. She was already moving toward the door. They're in the building and they know this is where Voss is. They're not going to wait for a clean opportunity. Statement is recorded, which means eliminating Voss eliminates the primary witness, but not the evidence. They know that. She stopped at the door and looked back at Sorel, which means they're not coming for Voss. Sorel went very still. Coming for the recording, Sloane said. Sorel looked at her tablet. The recorder beside it. At Harmon. The calculation moved through her face in real time fast, professional, arriving at the same place. Sloane was already standing. Move it, Sorel said to Harmon. Now, not to a vehicle, not yet somewhere in this building that isn't this room. Harmon was already at the door. He handed the recorder to one of his team members and spoke low and fast, and the team member left at a pace that was rapid without being visibly urgent. Sloane was in the hallway. She was running a parallel calculation. 2 contractor, assets unaccounted for in a 14 access point building. They had been at the staff entrance, which was on the east side of the building, ground floor. Voss was on the second floor, room 214, north corridor. The most direct internal route from the east entrance to room 214 ran through the main stairwell and up through the central hub. But if they knew the layout, and they might, the same way the men last night had known the ER configuration, they wouldn't take the direct route. They'd take the route that minimized contact with staff, the service corridor. It ran parallel to the main corridor on both floors, primarily used for equipment transport and laundry. Access via 2 stairwells that didn't appear on the standard visitor map. Quieter, less monitored, less traveled at any hour, and completely accessible if you had a building map and the right kind of patience. Started moving toward the south service stairwell. Harmon's voice behind her, Mercer. Service corridor, she said without stopping. They'll come through the service stairs. She heard him relay it into his radio as she pushed through the door. The service corridor on the second floor was institutional in the specific way of spaces. Nobody was meant to look at bare concrete block walls, overhead conduit, the smell of cleaning fluid, and institutional laundry. The lighting was worse than the main corridor. 2-wheeled equipment carts were parked against the left wall. A linen hamper sat near the far end. She moved fast and quiet, the way she had moved through worse spaces in worse conditions. She heard them before she saw them. Not loud, just wrong, the particular quality of footsteps from people trying not to make footsteps, which creates its own distinctive rhythm. Coming from the north service stairwell, not the south. She had guessed wrong by 1 stairwell, which meant they were already on the floor, which meant they were closer to 214 than she was. She reversed direction. She didn't have a radio. She didn't have a weapon. She had a hospital badge, a set of scrubs, and a working knowledge of the building layout that 6 years of night shifts had put into her body, the way all genuine knowledge gets there, through repetition, through necessity, through being the person who knows where the crash cart is and where the backup oxygen is stored, and which corridor connects to which at 3A. When everything else is closed. She came out of the service corridor through the north access door and moved into the main hallway at a pace that was brisk but not running. Running drew attention, drew questions, created the kind of visible disruption she couldn't afford. She needed to be a nurse, moving quickly toward a patient, which was something she had been doing all night and could do without thinking. Room 214 was ahead. The door was closed. The north service stairwell door was between her and room 214, and it was moving. She altered her course without breaking stride and positioned herself directly in the path of whoever was coming through that door, and she hit the linen hamper at the corridor junction hard with her shoulder and sent it rolling forward. In the same moment, the door opened. The hamper caught the first man at knee height, and he stumbled. And in the stumble, his forward momentum carried him into the wall, and in the time that created, she processed both of them 2 men, civilian clothes. The larger one recovering faster than she'd expected, the smaller one already reading the situation, and not fooled by the accidental look of it. The larger one reached for her. She was already not where he was reaching. What happened in the next 9 seconds was not elegant. It was the product of muscle memory from a training program that had never cared about elegance, that had cared exclusively about outcomes in situations where the alternative to an outcome was not walking back. She used the wall and the corridor width, and the hamper still rolling between them, and the simple that neither man expected a floor nurse to respond the way she responded. And she created enough delay and enough noise, the hamper going over, a crash of metal against concrete, her own controlled voice calling security, north corridor, second floor, that by the time the larger man had recovered enough to be a serious threat, Harmon's people were coming through the main stairwell door at the corridor's end. There was a moment, very brief, very clear, where the 2 contractor assets assessed the situation. The recording was gone from the room. Harmon's team was in the corridor. The woman who was supposed to be a floor nurse had just done things that floor nurses don't do. And now she was standing between them and the room, and there were 4 armed federal agents 20 feet behind her. They ran, not toward her, back through the service door. Harmon's team went after them. Sloan stood in the corridor and breathed. The linen hamper was on its side, white towel spread across the linoleum. Service door was still moving. Her left shoulder ached from hitting the hamper, and the impact had been harder than she'd planned. She rotated it once, felt the movement was intact, decided it was a problem for later. The door to room 214 opened. Voss was standing in it, IV line still attached, chest tube drain clamped for mobility, wearing the expression of a man who has heard enough from the inside of a room to know what happened outside it and is not entirely comfortable with how that knowledge makes him feel. "You should be in bed," she said. "You should not be doing what you just did." He looked at the hamper, the towels, the service door. "That was you." The hamper helped. He looked at her for a moment. Then quietly, "Thank you. Thank me when this is over." She moved toward him. "Get back in the bed. Your chest tube is draining, and you just jarred it standing up. And if you get a secondary bleed, we're back at square one." He went back in. She followed. She checked the drain output was within acceptable parameters. Nothing acute, and she repositioned his pillows and checked his oxygen saturation and did the 4 or 5 things that needed doing clinically. And she did them with the same systematic attention she would give any patient, because he was a patient. That part was real, regardless of everything else. She was checking the chest tube insertion site when he said, "The other people from Karwan, the one Sorel told you about. What about them?" "One of them, the one with the manufactured psych evaluation. His name is Aldrich Bowe. He's been fighting the discharge for 3 years." He paused, and the pause had the specific texture of someone deciding how much to say. "He's not doing well. The fight has cost him. The people who targeted him knew exactly which levers to pull." Sloan smoothed the dressing and straightened up. "Is he safe?" "Sorel's team located him this morning. He's being brought in." Voss looked at the ceiling. "I've been carrying this for 6 years. The documentation, the plan, the idea that eventually there would be a moment where it could go somewhere. I didn't think about what it would cost the people adjacent to it when that moment came. You're thinking about it now." "Yeah." A pause. "Is that useful?" Considered. "Depends on what you do with it." She moved toward the door. "Lie flat. Don't touch the drain. I'll be back to check in an hour." "Mercer." She stopped. "Greer the surgeon. I heard what happened last night." "In the bay." He met her eyes. "They weren't just going to use the dossier against you externally. Someone in this hospital has been feeding information to the contractor. The report Greer filed against you this morning, the formal complaint, the one he threatened it, was submitted through a third-party documentation system that we've flagged as a data collection point for the contractor's intelligence network. The information landed with a specific weight. He didn't know what he was feeding," Voss said. "My assessment. He's not an operative. But someone has been using the hospital's complaint and incident reporting system to monitor personnel. And Greer's complaint about you was the kind of specific flagging that the contractor uses to identify targets." Sloan stood at the door and processed that. It wasn't that Greer was part of it. She'd already decided he wasn't intelligent enough to be part of something this operational. But the system he'd used, the formal complaint process, which was managed by an outside HR contractor that the hospital had switched to 18 months ago, was compromised, which meant that every formal complaint, every incident report, every flag submitted through that system had potentially been visible to people who had no right to it, which meant her 6 years of documentation might have been working against her longer than she'd known. "Who else knows about the HR system?" she said. "Sorel is briefing administration now." Voss's voice was careful. "Quietly." "How quietly?" "Quietly enough that Greer doesn't know it's coming." She looked at him, looked at the window, looked at the door. "I'll be back in an hour," she said, and went back downstairs. The ER at 11:15 a.m. was running at medium intensity, manageable, nothing acute, the kind of morning that would seem calm if you didn't know that 2 contractor assets were currently being contained somewhere in the upper levels of the building by federal agents, and that a deputy director of defense intelligence was 2 floors up briefing the hospital's chief of medicine about a compromised reporting system, and that a formal federal proceeding was being initiated against 3 senior officials who had spent 6 years believing their cover was permanent. Sloan checked her patients. She updated her documentation. She answered a question from one of the travel nurses about a medication interaction and explained the answer clearly and correctly and moved on. At 11:48 a.m., Dr. Marcus Greer arrived for his shift 42 minutes early. He came onto the floor looking the way a person looks when they have been told something and are still deciding how to hold it off balance in a specific way, the certainty slightly dislodged. He went to the nurse's station and looked at the board and then looked at Sloan, and she could see the moment he registered that she was there, had been there, was functioning and present, and giving him nothing to work with. "I thought you were off shift," he said. "I came back in." She finished her notation. "We're short-staffed. I heard there was an incident upstairs this morning." Hospital security handled it. He looked at her for a long moment with the expression of a man reading a situation that isn't organizing itself the way he expected. "The chief's office called me," he said, slower now, less certain, "about the formal complaint. I assumed they would. They said there was a delay in processing." He put his hands in his coat pockets. "They said the reporting system was under review." "I heard that too," she said, which wasn't quite a lie. Something was working behind his eyes. He was putting things together, or trying to, but he was putting things together, but he was working from incomplete information, and the pieces weren't making a shape he recognized. "The military patient upstairs," he said finally. "The federal people. You'd have to speak with administration about that." "Mercer." He said her name, and it came out different. This time less like a wrong answer, and more like something he couldn't quite pronounce. "What is actually going on?" She looked at him directly. For the first time all night, all morning, she looked at him without the filter of managing what she showed him. "Patience," she said. "That's what's going on. Same as always." She went back to work. At 12:06 p.m., her phone buzzed with a text from Harmon. "Both assets in custody. Building is secure. Sorrell wants you upstairs when you have a break." She looked at the board. She looked at her patient list. She thought about the documentation moving through federal channels and the 3 names in Voss's records and the 4 soldiers from Karwan province who had deserved a more honest accounting of what happened to them. She replied, 20 minutes. She finished the chart she was working on and moved to the next patient, and she was halfway through the door of Bay 6 when Gloria Tesh appeared at the end of the corridor. The charge nurse's face had a quality Sloan had never seen on it before, not panic. Gloria didn't panic, but a controlled alarm that meant something outside the normal category of ER problems. "Administration is here," Gloria said. "Chief of medicine, 2 board members, and someone from the outside who I don't recognize. They're asking for you, for me specifically, by name." Gloria paused. "And they're also asking for Dr. Greer, separately. A beat. They put him in a room by himself before they came looking for you." Sloan read the shape of it. "Tell them I'll be up in 5 minutes," she said. Gloria went. Sloan stood in the doorway of Bay 6 and looked at the patient inside, an older woman, mid-70s, clutching the side rail with both hands, frightened and in pain and deserving of someone's full attention. She went inside and spent 4 minutes doing exactly that. Then she washed her hands, checked her badge, and went to face what was coming. She was halfway to the elevator when she heard it. A sound from the direction of the administrative corridor, not loud, not dramatic, but specific. The sound of a door slamming in a way that meant something behind it had gone wrong, followed by a voice, Greer's voice, sharp and uncharacteristically high, saying something she couldn't fully make out. Then silence. Then Harmon appeared at the end of the corridor, moving fast, his face carrying the specific expression of a man who has just received information that has changed the structure of the situation. He reached her and stopped and said, "Sorrell just got a call." "What call?" The third name in the documentation. He held her gaze. A civilian intelligence official. He's not in Washington. She waited. He was identified 40 minutes ago at Doral Springs Regional Airport. Harmon's voice was level and controlled, and underneath the control was something that wasn't. He boarded a private aircraft. We had teams moving to intercept, but the aircraft was already taxiing before authorization came through. He's running, she said. He's running. A pause. And we had one asset positioned to prevent exactly this scenario. One person with current authorization and proximity and the specific knowledge set to identify him on the ground before he got on that plane. He held her eyes. That asset was occupied in this building. The weight of it landed in her chest like something physical. Not guilt she had been where she needed to be, had done what the moment required. But the specific cost of a choice made under pressure when you're working with incomplete information and insufficient resources and a timeline that doesn't accommodate all the things that need doings simultaneously. Where is the plane going? She said. We don't know yet. We're working on it. What do you need from me? Harmon looked at her for a long moment. The administrative corridor was quiet. Somewhere above them, a federal proceeding was being initiated. Somewhere in an interview room, Marcus Greer was being told things that would reorganize his understanding of the last 12 hours. And somewhere in the airspace above Doral Springs, a man with a significant motive for disappearing was making himself disappear. Right now, Harmon said. The administration meeting. They need to hear from you. The chief needs to understand what happened in this building, and he needs to hear it from someone who was in it. He paused. After that, I need to show you something. What? Pulled out a tablet. On the screen was a flight manifest partial, the kind pulled from preliminary tracking data, names and routing still being confirmed. He held it toward her. She looked at the manifest. One name on it she recognized immediately, not from the documentation, not from Carwan, not from anything Voss or Sorrell or Harmon had told her in the last 12 hours. A name she recognized from 6 years ago, from a different kind of document entirely from the original after-action report she had filed before anyone altered anything, the report she had written in the hours after the worst day of her professional life, when she was still shaking and exhausted and trying to put accurate words to catastrophic events. A name that should not have been on a flight manifest out of Doral Springs. A name that told her the shape of the original betrayal was larger than even Voss's documentation had suggested. She looked up from the tablet. Harmon was watching her face. You recognize it, he said. Yes, she said. Who is it? She looked back at the manifest, at the name, at the city of origin, and the timestamp, and the tail number of the private aircraft, all of it preliminary and subject to confirmation, but coherent and specific and real. Someone who was supposed to be dead, she said. Harmon gave her 11 seconds. That was how long he waited before he said anything else. Not because he was being considerate, though maybe he was, but because he was reading her the way he read everything. And he needed those 11 seconds to understand what her face was doing and what it meant. What it was doing was very little. That was the answer. And it told him more than expression would have. Name, he said. Not a demand, just the word. Major Theron Aldous. She said it the way you say something you've rehearsed saying without ever intending to say it out loud. He was the intelligence liaison attached to our unit in Carwan province. He was the one who provided the operational assessment that put us in that valley. She paused. The after-action report listed him as killed in action. Friendly fire. He was on the casualties list. I wrote his name on the medical record myself. Harmon looked at his tablet, at the manifest, back at her. You're certain. I treated him in the field. I know what he looks like. She looked at the name on the screen one more time and then looked away. He was alive when I left him. He was stable. The injury was significant, but survivable. By the time I filed the after-action report, he was listed as dead. A beat. I thought there was a documentation error. I was too exhausted, and 2, I was in a bad place. I flagged it internally, and nothing came back, and eventually I told myself I'd misremembered. But you hadn't. No. Harmon was already typing. His thumb moved fast across the screen, sending something she couldn't see to someone she didn't know. If Aldous is alive and running, it means he's been operational this entire time. Under a different identity, most likely. Which means the contractor... He stopped, recalculated. He's not connected to the contractor. He is the contractor. The corridor was still empty around them. Somewhere above, the administration meeting was waiting. Somewhere outside, private aircraft was gaining altitude, with a man on it who had been dead for 6 years and had spent those 6 years building the architecture of his own protection from the inside. The people he's been protecting, Sloan said slowly. The 3 names in Voss's documentation. They didn't hire Aldous to clean up the Karwan situation. Came to them. He had the leverage already, because he knew what happened, and he was officially dead, which meant he could operate with no accountability at all. She thought it through as she spoke, the way she worked through a complicated clinical picture, not guessing, building. He's been running the containment operation himself. Contractor is his cover. The 3 officials are his protection. They needed him to stay quiet. So they gave him the infrastructure to do the cleaning. And when Voss started moving, Harmon said, Aldous activated everything he had. Because Voss's documentation doesn't just expose the 3 officials. It exposes him. The original mission logs show that the intelligence assessment he provided was wrong specifically, deliberately wrong. The 4 soldiers who died in that valley died because of information he shaped. She looked at Harmon. And then he let himself be listed as dead, walked away from the wreckage he created, and spent 6 years making sure anyone who could contradict that narrative couldn't be heard. Harmon looked at her. You need to tell Sorrel this. Right now. I know. The administration meeting. Can wait 10 minutes. She was already moving. Come on. Sorrel took 4 minutes to hear it and 30 seconds to begin acting on it. She was on the phone before Sloan finished the second sentence, and the conversation that followed was brief and operational and conducted in the kind of institutional shorthand that meant things were moving through channels at a speed that regular procedure didn't allow. Harmon's tablet was producing continuous updates, flight tracking, identity cross-referencing, the preliminary results of a rapid biometric search against the name Theron Aldous, and 6 years of alternative identification possibilities. Voss listened from the bed. When Sloan finished, he was quiet for a moment. Then, I didn't know he was alive. I know. The documentation, I pulled everything I could access. His death record was complete. Cross-referenced, corroborated, signed by 3 separate officials. He looked at the ceiling. He built it well. He had 6 years and no accountability, she said. And he knew exactly what an airtight record looks like because he'd spent his career reading them. Can they stop the plane? Sorrel, offer call. We have FAA coordination in progress. The aircraft filed a flight plan to a private airstrip in western Nevada. We have federal assets positioned there, but she paused, and the pause had weight. If he anticipated interception, the filed plan may not be the actual destination. He anticipated everything else, Sloan said. Yes, Sorrel's voice was flat. He did. The room absorbed that. Sloan looked at Voss. Chest tube drain, the vitals monitor, the untouched breakfast tray. At a man who had carried 6 years of documentation through 6 years of careful living and had ended up in a hospital bed in Doral Springs with a hole in his chest and a situation that was more complicated than either of them had known when the night started. The administration meeting, she said to Sorrel. I need to be there. I'll come with you. No, she thought about it. You'll make it federal in a room that isn't ready for federal yet. Let me go in first. Sorrel looked at her for a moment. What's your read on the chief? He's not corrupt. He's political. There's a difference. Sloan moved toward the door. Give me 20 minutes before you come in. The conference room on the third floor was the kind of room hospitals use when they need to have conversations that don't belong in offices. Round table, no hierarchy implied by the seating, a credenza with a coffee service nobody was going to touch. The chief of medicine, Dr. Paul Weatherton, 61, silver-haired, with the particular bearing of a man who had run a complicated institution for a long time and had developed his own methods for assessing a room, sat at the far end with two board members. Sloane knew, sight, but not by name. The person she didn't recognize was a woman in a dark blazer, who introduced herself simply as being from the hospital's legal office and said nothing else for the next 15 minutes. Greer was not in the room. He had been in a separate room, Sloane noted. That separation was deliberate, and the fact that Weatherton had agreed to it told her something about how much Sorrell's preliminary briefing had shifted the landscape. She sat down south. Weatherton looked at her with the careful attention of a man who has been told he needs to revise his understanding of something and is still in the process of that revision. Nurse Mercer, he said, I want to start by saying that what I've been told this morning is significant. And I want to hear directly from you. What specifically have you been told? She said. That the incident reporting system used by our HR contractor has been compromised. That it was used to collect intelligence on hospital personnel. And that the formal complaint filed against you this morning was submitted through that system and may have been flagged to outside parties before it reached my office. He paused. I want to understand how that connects to what happened in this building last night and this morning, she told him. She didn't tell him everything. She left out Karwan province, left out Aldous, left out the specifics of Voss's documentation, because those were federal matters and Sorrell would handle them. What she told him was the operational shape of the previous 16 hours, the patient who arrived with military protection, the security breach, the two individuals who had entered the building this morning through unmonitored access points, and the connection between the contractor asset operation and the hospital's compromised reporting system. She told it plainly, without drama, in the same register she used for patient handoffs. Here is what happened. Here is what it means. Here is what needs to happen next. Weatherton listened without interrupting. When she finished, one of the board members, a woman with reading glasses pushed up on her head, said, The complaint, doctor. Greer filed this morning. You're saying it was used against you by the same who sent armed individuals into this hospital. I'm saying the system it was submitted through was accessible to those people. Whether Greer knew that, no. I don't believe he did. Complaint itself was based on a procedural disagreement about an intubation approach that I believe put a patient at risk. She held the board member's gaze. The nursing notes from that interaction document my assessment, the outcome of the first intubation attempt, and the clinical rationale for my recommendation. The documentation exists independently of the reporting system. The legal office woman made a note. Weatherton leaned forward slightly. Nurse Mercer, I need to ask you directly, your background, your experience before coming to Callaway. Is there anything in it that is relevant to what happened here? Question sat in the room. She had known it was coming. Had known it since she'd decided to walk into this meeting. Because the question was inevitable, and the only choice was how to answer it. Yes, she said, I have a military background that I haven't disclosed to the hospital. My nursing training began in the military, and my clinical skills in trauma were developed in operational contexts that go beyond standard civilian nursing practice. Weatherton absorbed that. Why didn't you disclose it? Because I left that life voluntarily, and I wanted to practice nursing as a nurse, not as a former operator. She paused. My clinical outcomes here speak for themselves. My license is current, my credentials are valid, and every procedural action I've taken in this building has been within scope. The military background doesn't change any of that. Explain some things, the board member said. Not accusatory. Just true. It might, Sloane said. The legal office woman looked up. The formal complaint filed by Dr. Greer. Splat, given the circumstances around the reporting system, we'll be placing it in abeyance, pending a full review. She said it in the tone of someone reporting a decision already made before the meeting started. That review will include the nursing documentation from last night's intubation incident. Sloane's nodded. Additionally, Weatherton said, the HR contractor relationship is being terminated effective today. Our IT team is conducting a full audit of data that passed through that system in the past 18 months. He looked at her steadily. That's going to be an uncomfortable process. I understand. I want to be clear about something. He leaned forward. What you did last night, and this morning for Commander Voss, for the patients in the post-procedure bay, that's not a small thing. I've been told enough to understand the scope of it. His voice dropped slightly, not warmly, but with the specific weight of a man saying something he means. The hospital owes you an apology for what happened in Bay 4, for the way Dr. Greer handled that situation. I'd rather have a working-size 4 laryngoscope blade stocked in every bay, she said. One of the board members almost smiled. The door opened and Sorrell walked in. The meeting extended 40 minutes past Sloane's original estimate. Sorrell was efficient and precise, and Weatherton was, to his credit, more adaptable than she'd expected the kind of administrator who had enough institutional experience to understand that when a deputy director of defense intelligence is in your conference room, the appropriate response is to listen carefully and ask practical questions rather than defensive ones. By the time it was done, 3 things had been agreed upon: the IT audit, the contractor termination, and a formal administrative review of the incident reporting system's data history. Sorrell also left 2 of Harmon's people assigned to hospital security for the next 72 hours, which Weatherton accepted without argument. On the way out, Sloane passed the door of the adjacent conference room. Closed. She could hear Greer's voice through it, not the words, just the register, which was higher and faster than his normal register, and had lost the specific quality of authority he wore like a coat. The voice of a man discovering that the architecture he'd built his confidence on had a serious structural problem at its foundation. Kept walking. She had no satisfaction in it. She'd checked herself for satisfaction on the way to the meeting and found something more complicated, the hollow tiredness that comes when something you've been holding against for a long time finally has somewhere to fall, and the falling is messier and slower and less clean than the holding had been. She took the elevator down and went back to the ER. The afternoon moved. Priya was still on. She'd picked up a double without being asked, which was the kind of thing Priya did without announcing it, and she watched Sloane come back onto the floor with an expression that asked 15 questions, and then, reading Sloane's face, asked none of them. Bay 6 needs a recheck, she said instead, and we have 2 new arrivals from the last hour. I've got them. Sloane clipped her badge. How's the flow? Manageable. Greer hasn't come down. He won't today. Priya processed that with the focused neutrality of someone storing information for later. Okay. She turned back to her workstation. Bay 6 is first. Sloane went to Bay 6. The patient from the morning, the older woman, mid-70s, the one she'd spent 4 minutes with before the administration meeting, had been admitted upstairs. A new patient occupied the bay, a man in his early 40s with a laceration above the eyebrow from a workplace accident, cooperative and uncomplaining, the kind of patient who apologized for being in the ER even when the ER was exactly where he needed to be. She cleaned and assessed the wound, determined it needed suturing rather than staples given the location, and got the supplies while he sat quietly watching her work. Does it need a lot of stitches? He asked. 7. Maybe 8. She set up the field. You'll have a small scar, but it'll fade. My wife's going to say I told you so. About what? About the machine I was using. She said it was too old, needed replacing. He shifted slightly and then held still when she asked him to. She was right. She usually is, Sloane said. He laughed once, carefully. Yeah. She sutured the laceration in 8 even passes, and dressed it, and went through the discharge instructions, and answered his questions, all of them, including the one about whether he could have a beer later, to which the honest answer was that one would probably be fine, but she wasn't going to put that in the paperwork, and she did all of it with the same attention she would have given him at 2A. On the worst night of the year, because that was the job, and the job was the thing she'd chosen, and even on a day like this one, maybe especially on a day like this one, was the thing that was straightforwardly real. He thanked her on the way out. She was already moving to the next patient. 3:17 p.m., Harmon came downstairs. He found her at the workstation between patients and stood beside her with his hands in his jacket pockets and the expression of a man delivering a mixed report. Plane, she said, landed at a private strip in southern Oregon. Not the filed destination. He kept his voice low. Our teams were 40 minutes behind him. By the time we had boots on the ground, the plane was empty. She had expected something like this. Had told herself not to expect a clean resolution because clean resolutions were what happened in stories, and this was a situation. And situations, had friction and gaps and the specific cruelty of almost. How far did he get? She said. We're working it. He had a vehicle staged at the strip. We have plates, we have a direction, we have aerial assets repositioning. He paused. We'll find him. How long? I can't give you a number. Turned back to her screen. The others, the 3 officials named in Voss's documentation. All 3 are in federal custody as of 2 hours ago. He said it without ceremony. 2 at their offices, 1 at his residence. The documentation Voss is carrying, combined with your corroborating statement, was sufficient for the warrants. He paused. It moved fast because Sorrell had been building the surrounding case for 14 months. The documentation was the last piece. Your statement was the lock. Thought about that for a moment. About the 2 hours in room 214 speaking into a recorder. About every specific thing she'd confirmed: dates, injuries, clinical decisions, outcomes with the particular effort of someone pulling material out of a compressed place. Aldrich Bowe, she said. The name from Voss's account, the man with the manufactured psychological evaluation, the 3-year fight. Being briefed right now by Sorrell's team. It's a lot for him to process. Harmon's voice shifted slightly. The other one, the one who was discharged under irregular circumstances. His name is Sergeant First Class James Farrow, retired. He's flying in tomorrow. She nodded. There will be a proceeding, Harmon said. Formal. Federal. You'll be called to testify. Your statement is recorded and corroborated, but live testimony will be required once the case moves forward. I know. Your military record, the real one, will become part of the evidentiary record. It's not going to stay sealed. She had known this too. Had known it the moment she walked into the administration meeting and said the words out loud. Some doors once opened. When? Probably 6 to 8 weeks for the initial proceeding. Potentially longer for the full case. He looked at her. There's also the question of the dossier they built against you. Even though we intercepted it, the information it contains is accurate, she said. My real name, my real record. They didn't fabricate anything. They just intended to weaponize it. Right. He was quiet for a moment. How are you doing with that? It was a human question, and it came from him with the slightly awkward quality of a man who dealt professionally in operational information and was attempting something more personal. She didn't hold the awkwardness against him. I'm on shift, she said. He accepted that. I'll be upstairs for the rest of the day. Voss is being transferred to the federal facility tonight. Transport is confirmed. He wanted me to tell you. Tell him I said, good luck. Harmon nodded and went back to the elevator. 4:45 p.m., Dr. Wetherton came down to the ER floor. He didn't do this often. The chief of medicine coming to the ER without an administrative purpose was unusual. Enough that 3 nurses looked up when he walked in. and the look on their faces said they were recalibrating something about how the day was going to end. He found Sloane finishing a patient note at the workstation and waited until she was done before he spoke. Dr. Greer has been placed on administrative leave pending the outcome of the review, he said, effective an hour ago. The board made the decision this afternoon. She looked up. The review will encompass the Bay 4 incident, his conduct over the course of the night, and his use of the compromised reporting system. Weatherton paused. Possible that the review will clear him of any intentional wrongdoing related to the external situation. The clinical conduct question, the Bay 4 intubation, that stands independently. He held her gaze. The resident and the respiratory tech both provided accounts today that corroborated your documentation. I didn't ask them to, she said. I know. They came forward on their own. He was quiet for a moment. I'm told that's not unusual where you're concerned. People here tend to trust your read of a situation. She looked at the workstation, at the patient list on the screen, at the board behind it, tracking the movement of people through a building that spent all its energy keeping them alive. What happens to his patients, she said. Dr. Lena Farrow will cover his caseload until the review is complete. He watched her face. That was your first question. He has patients who need continuity of care. That's a practical concern. Yes. Weatherton straightened slightly. It is. He paused. I owe you an apology, Mercer. More than the one I gave you upstairs. Last night when Greer called security on you in that bay, I was notified. I chose not to intervene because Greer has seniority and the situation seemed manageable. His voice had the particular quality of a man saying something genuinely uncomfortable. It wasn't the right call. She looked at him. Do we have adequate laryngoscope blade inventory in the standard trauma bays? He blinked. I'd have to check with supply. I'll put in a request. She turned back to the screen. Thank you for telling me about Greer. He stood there for another moment, then nodded and left. Priya appeared at her elbow within 30 seconds. Did he just apologize to you? He raised a supply inventory concern, Sloane said. Priya stared at her. He absolutely apologized to you. Do you have the chart for Bay 9? Priya handed it over and they went back to work. 6:30 p.m. The day shift ended and the evening shift arrived, and Sloane, who had now been at the hospital for more than 12 hours on top of a night shift, did not leave. She told herself it was because the handoff was complicated and the incoming nurse, a solid clinician named Marcus Webb, who had 3 years on the floor, needed a thorough briefing. That was true, and also not the whole truth. The whole truth was closer to the things she'd recognized about herself sometime in the early morning hours and hadn't fully looked at yet, that the ER was the place where she knew what to do. Infects, and the world outside it was currently a very complicated place, and she was staying in the known coordinates for as long as she could justify it. Webb took the handoff patiently and thoroughly. At 7:12 p.m., she finally changed into her street clothes and sat in the break room with a bottle of water and her phone and gave herself 5 minutes to do nothing. Just sit. Just let the day exist behind her without chasing it. Harmon texted at 7:18, Voss is being transferred now. He wanted you to know the chest tube is out, and he walked to the transport vehicle under his own power. She replied, Good. A minute later, he also said to tell you, and I'm quoting, the size 4 blade was right. She looked at that for a moment. Then she put her phone in her bag and stood up and was reaching for her jacket when the break room door opened. It was Priya, and Priya's face had the look of someone carrying news they're not sure how to hand over. There's a man at the ER entrance, Priya said. He's not a patient. He's asking for you specifically. He says his name is Aldrich Bowe. Sloane put her jacket on. He looks. Priya paused, choosing the word carefully, like he's been through something. For a long time he has, Sloane said. Do you know him? I knew him. She picked up her bag. Tell him I'll be out in 2 minutes. Priya left. Sloane stood in the break room alone for a moment and thought about Harwan province and 6 years of silence and a psychological evaluation manufactured by a man who had faked his own death. and all the ways a person's life could be bent out of its natural shape by someone else's decision to protect themselves. Then she thought about Aldrich Bow on the outside of a door, asking for her by name, having come all this way. She went out. He was standing near the ambulance bay entrance, not inside, which told her something about his current relationship with hospitals, not avoidance exactly. Just the specific hesitation of a person who has learned to be careful about enclosed spaces managed by institutions. He was 47 or 8, thinner than he should have been, with the look of someone whose face had done a lot of difficult work over a long period of time. He had his hands in his jacket pockets, and he was watching the entrance without tension, just patience. He saw her, and his shoulders dropped about a half-inch, not relief exactly. More like the particular settling of a person who has been holding themselves very straight for a very long time, and has found a place where they don't have to. Mercer, he said, Bo. She stopped in front of him, looked at him, let herself look without the clinical assessment filter, just as a human being looking at another human being she'd last seen in circumstances she still dreamed about occasionally. You look terrible. Yeah, he almost laughed. You look like you haven't slept. I haven't. She looked at the entrance. Do you want to come inside? I can get you something. He glanced at the door. Maybe in a minute. Okay? They stood there in the November evening, which was cold and clear and smelled like exhaust from the ambulance bay, and something that might have been rain coming from the west. Sorrell's team told me about the 3 officials, he said. About the warrants, I heard. They told me about your statement. Corroboration. He was quiet for a moment. You documented everything. Even back then. I did. I couldn't, after everything that happened. I tried to file supplemental reports. They kept disappearing. I kept being told the record was complete. Nothing additional was needed. My assessment was inconsistent with the official findings. His voice was flat, which was the tone of a person who has told this story enough times that the flatness is load-bearing. I pushed for 3 years, and then they used the psych evaluation. And after that, nobody listens to a guy with that on his record. I know, she said. I needed someone to have documented it correctly from the beginning. He looked at her. That someone was you. She didn't have a response that wasn't either too much or too little, so she stayed quiet, which she thought was probably right. Aldous, he said. They told me he's running, she said. They're working on locating him. He was the one. It wasn't a question. He ran the whole thing from behind the death record. Yes, Bo's jaw moved. Something crossed his face that was old and specific and not fully resolved, and she recognized it because she had her own version of it, had been managing it for 6 years. And she understood that the managing didn't end just because the facts were finally moving somewhere. What do I do now? He said. It wasn't helpless. It was a real question from a person who had been fighting in one direction for 3 years and was now standing in a field where the direction had changed and the map was different. The proceeding, she said. Your testimony. Your real record. She looked at him. After that, I don't know. That part's yours. He nodded slowly. Tonight, she said, you should eat something. Come inside. I know where the decent coffee is. He looked at the entrance again. This time, he followed her through it. At 9:04 p.m., Harmon called. She was in the break room with Bo, who had eaten 2 granola bars and was working on a cup of coffee with the focused attention of someone for whom ordinary things had become significant again. She stepped into the hallway to take the call. We found the vehicle, Harmon said. Abandoned at a commercial truck stop in Northern California. He switched. To what? Still working it. But there's a secondary development. A pause. We ran Aldous against the biometric database. His surgical alteration facial, mostly some bone structure, it was done professionally, which narrows the field. We cross-referenced against intelligence community contacts who've done identity reconstruction work, and we got a hit. Okay, she said. The identity he's been operating under for 6 years. The name, the background, the professional history. Another pause, and this one had a quality she hadn't heard from Harmon before, not uncertainty, but the particular care of someone who has read a piece of information and is choosing how to deliver it. Mercer. The identity he built, it's in the medical field. She went still. He didn't just disappear, Harmon said. He rebuilt. New face, new name, new credentials. He's been practicing specifically. He's been in hospital administration. Medical systems management. The pause again. We're running the identity against every institution in the federal database, and we're getting matches. How many? 17 facilities over 6 years, moving every 8 to 14 months. His voice was careful. Callaway Veterans Medical Center is on the list. He was here under a contract administrative role. 14 months ago, before your current HR contractor came on board. The hallway was very quiet. He chose the contractor, she said. We think so. Yes. The contractor relationship was established through an administrative recommendation made during a consulting engagement 14 months ago. Harmon's voice was flat and precise. Place the system. He built the data collection point. He put it here specifically because your personnel file was here, and he needed to know whether you were a threat. 6 years of documented nursing notes. 6 years of incident reports and patient interactions and clinical flags, all of it moving through a system that a dead man had planted in the building where she worked, because she was the one witness he couldn't account for, and couldn't find, and couldn't silence until she silenced herself by being ordinary, by showing up and doing her job, by building the small and real life she'd chosen. And he had found her anyway. He had found her 14 months ago and had put a surveillance architecture around her file and had waited to see whether she was going to be a problem. He's known where I was, she said. For 14 months. Yes. Then why did he wait? Why not move earlier? We think Voss's operation changed his timeline. Voss was getting close to actionable, and Aldous had to prioritize Voss. You were contingency. You were the backup problem, the one he'd deal with after Voss was handled. Harmon paused. It's also possible he wasn't sure you were a threat. Your nursing notes, your incident reports, all of it was professional and clinical and gave him nothing that looked like active intelligence gathering. Because she hadn't been gathering anything. She had just been a nurse. The record he built, she said, the dossier. He assembled that himself. Almost certainly, it has the specific shape of someone who knows institutional documentation, who knows which records to pull, how to contextualize them, how to build a narrative that looks official. A pause. He built it preemptively, had it ready. As soon as Voss arrived and you were identified, he activated it. She leaned against the hallway wall. 14 months. He had been 14 months ahead of her, watching, building, waiting. And she had spent 14 months coming in for her shifts and checking her patients and filing her notes and doing everything correctly. And every piece of it had been visible to a dead man sitting behind a screen somewhere reading her file. The thing she felt was not fear. It was more specific than fear. Fear. And older, the cold, grinding anger of someone discovering that the precautions they took weren't enough, not because they were wrong, but because the threat was more patient and more resourced, more deeply embedded than any precaution could reach. Where is he now? She said. We're closing the net. Harmon's voice was steady. We have 17 identities to cross-reference. We have biometric data. We have a vehicle switch in Northern California. And we have enough federal authority to move fast when we locate him. He paused. Can't vanish again. His infrastructure is gone. The contractor, the 3 officials, the hospital system, all of it is compromised, and he knows it. He has no protection left. He's running with nothing but a head start. How big is the head start? Smaller than he'd like. She looked at the break room door. Through the window in it, she could see Aldrich Bowe sitting at the table with his coffee, staring at something in the middle distance, doing the slow and private work of integrating a new version of events. Harmon, she said. Yeah. The 17 facilities. The administrative roles. He had access to personnel files at all of them. Yes. Then there are other people like me. Other people he surveilled, flagged, built contingency dossiers on. She looked at the break room door. People who documented things correctly a long time ago, and then tried to build ordinary lives. A silence. That's Harmon started. That's a much bigger case than 3 officials and 1 contractor, she said. Another silence, longer. Yes, he said quietly. It is. She looked at the break room window, at Beau with his coffee. At the hallway around her, the nurse's station visible at the far end, the board showing the evening's patient load, the ordinary infrastructure of a place doing ordinary work. When you find him, she said, I want to be told. Before it goes public. I want to know the moment he's in custody. You'll be my first call. She looked down at her phone. Time 9:11 p.m. At the list of things she still needed to do before this day was over, which was long and strange, and not at all what she'd expected when she came in for a Tuesday night shift. One more thing, she said. What? The 17 facilities. I want the list. Mercer, I need to know who else he was watching. Her voice was calm, which it always was, and underneath the calm was something that had been there since 2 a.m. and had been working its way toward the surface all day. Not fury. It was too hot for what she was feeling. Something more like the low and absolute determination of a person who has just discovered the full dimensions of what was done to her and to people she served with, and has decided that the discovering is not the end of the thing, but the beginning. I'll coordinate with Sorel. I'll do it through the proceeding. But I want the list. Harmon was quiet for a moment. I'll see what I can do, he said. She ended the call. She stood in the hallway for a moment longer, alone, with the specifics of 9:11 p.m. on a Wednesday in November in a building where she had spent 6 years, being exactly what she said she was. Then she pushed the break room door open and went back in. Beau looked up. There's a development, she said, and sat down across from him and told him what there was to know, because he deserved to know it, and because the conversation that came after was going to require 2 people who had both been in that valley and had both carried the weight of it and were both, for the first time in 6 years, not carrying it alone. Outside, the night continued. The ER continued. The hospital continued. And somewhere in the distance, a net was tightening around a man who had spent 6 years being dead. The only question was what he would do when it closed. Sass listened the way soldiers listen, without interrupting, without reacting to the surface of things, processing at a level below the visible. When she finished telling him about Aldous and the 17 facilities and the surveillance architecture built around her personnel file, he sat for a long moment with his coffee cooling between his hands. 14 months, he said finally. Yes. He was watching you for 14 months, and you didn't know. No. He looked at the table. How are you sitting there that calm? I'm not calm, she said. I'm just not loud about it. He looked at her then, and something's in his expression shifted, not softened. That wasn't the right word, but became more honest. The way faces get when they stop performing a version of themselves and just exist for a moment. The psych evaluation they put in my file, he said. 3 years I fought that. 3 years of being told my perception of events was compromised, my recall was inconsistent, my judgment wasn't reliable. He paused. You know what the worst part was? After a while, I started to wonder if they were right. If I had misremembered, if the version of Karwan I was carrying was actually mine, or something I'd constructed. It was yours, she said. I know that now. He turned the cup in his hands. But 6 years is a long time to wonder. She didn't offer him anything easy, because there wasn't anything easy to offer, and he was not the kind of person who would have accepted it. The proceeding will put it on the record, she said. Your account, the unaltered documentation, your testimony. It won't undo 6 years, but it will exist permanently in the official record that you were right. Is that enough? She thought about it honestly. I don't know. I think it depends on what you do with it after. He nodded, not satisfied, but accepting. The nod of someone who has asked a question knowing the answer was going to be incomplete and asking it anyway, because incomplete was still better than silence. They sat a while longer in the break room, while the hospital moved around them, and it wasn't comfortable exactly, but it was real. And real was what both of them had been working toward for a long time. Harmon's first call came at 6:44 the next morning. Sloan was home. She had actually slept, not enough, not well. The particular fragmented sleep of a person whose nervous system was still running hot from the previous 40 hours, and she was standing in her kitchen in the gray morning light when the phone rang. Oregon State Police located the second vehicle, Harmon said, abandoned at a marina outside Coos Bay. There was a boat registered to one of his operational aliases that had been fueled and provisioned within the last 48 hours. He was planning water egress, she said. He was. The boat is still at the dock. Coast Guard is working the bay. Local marine units have the coastline covered north and south. A pause. He's running out of room. She drank her coffee. How long? Could be hours. Could be less. We have eyes on a 6-mile radius, and it's tightening. He paused. Call you when it's done. She put the phone down and looked at her kitchen. The ordinary objects of an ordinary morning, the coffee maker, the dish rack, the window, with its view of a residential street that was just beginning to accumulate the sound of people moving through their days. She had looked at this kitchen every morning for 6 years, and it had looked the same. And today it looked exactly the same as it always had, and also permanently different, because she was different, and the difference wasn't something she could put down. She showered. She dressed. She went back to the hospital because her shift started at 7, and there were patients, and the patients did not pause for the resolution of 6-year-old cover-ups. Harmon's second call came at 10:22 a.m. She was between patients a 4-minute window, the kind that barely existed on a good day, and she answered on the second ring. Coast Guard found him at a sea cave 2 miles south of the marina, Harmon said. He'd been there overnight. He surrendered without incident. A pause. He's in federal custody. She stood in the hallway and felt the specific weight of that sentence land in her body. Not dramatic. Nothing collapsed. Nothing flooded. More like a long, sustained pressure releasing. The way a building settles, imperceptibly but real. Is he hurt? She said, because she was a nurse, and the question was involuntary. No. Cold and dehydrated, but functional. A pause that carried something close to dry appreciation. He'll be properly processed. The 17 facilities. The list. Being compiled now. Sorrel will have it by end of week. She's flagging every individual whose file was accessed so they can be notified and included in the proceeding, if applicable. How many people? First estimate is 43 personnel across the 17 facilities, spanning 6 years of surveillance and contingency targeting. He paused. Some of them won't even know yet that they were on a list. She thought about that for a moment. 43 people who had built their lives around the assumption that the past was behind them, and who were about to find out that someone had been watching from a distance, waiting to see if they became inconvenient. Make sure the notification process is handled carefully, she said. Some of those people are going to need more than a form letter. Pass that to Sorrel. Pass it firmly. A pause. Understood. Something shifted in his voice. Mercer. It's done. The 3 officials are in federal custody. Aldis is in federal custody. The contractor organization is being formally dissolved. The documentation is authenticated and in the federal evidentiary record. Your corroborating statement is locked. He paused one more time. It's done. She looked down the hallway, at the board with its patient roster. Priya crossing from Bay 3 to the workstation with a tablet under her arm. The ordinary, continuous activity of a place that had nothing to do with any of this and everything to do with why she had stayed. Thank you, she said. You did most of the work. We both know that's not accurate. Fair enough, he said, and she could hear something close to warmth in it. Take care of yourself, Mercer. She ended the call and stood in the hallway for exactly 30 seconds, doing nothing, which was the most she was going to give herself right now, and then she went back to work. Weeks that followed were not simple and not clean, because nothing real is simple and clean. The formal proceeding was announced publicly in the second week of December, and the names of the three officials appeared in the federal case filing, and the press moved on it, the way the press moves on things fast and loud, and not entirely accurate, and then loud again when corrections were issued. Sloane's name appeared in some of the early coverage as a nurse and former military medic whose testimony was central to the corroboration. She did not read most of it by choice. What she did read carefully was the official record correction filed on behalf of the 4 soldiers killed in Karwan province. Their families had been contacted by Sorrell's office before the public announcement, a detail Sorrell had insisted on, which Sloane found she was grateful for in a way that was hard to articulate. The record correction didn't give those families anything back, gave them the truth, which was what Voss had told her it would give them. And she had said, whether that's enough is not something I can answer, and she still couldn't. But she thought it mattered that the truth existed in the official record where the lie had been. Dr. Marcus Greer's administrative review concluded in the 3rd week of December. The Bay 4 intubation was formally found to represent a clinical decision that did not meet the standard of care based on the documented outcome and the corroborating accounts of the resident and the respiratory technician who had been present. Greer was not terminated. He was required to complete a structured remediation program. His trauma surgery privileges were restricted pending a performance review period, and a formal note was placed in his credential file. It wasn't everything. Sloane had known it wouldn't be everything. Institutions move toward accountability in increments, and the increments are often frustrating and insufficient feeling. And she'd had enough experience with institutional accountability to understand that partial was sometimes the realistic ceiling. What she had not anticipated was the morning Greer appeared at the nurse's station and asked to speak with her. He looked like a man who had spent several weeks in a room with the unpleasant version of himself and had come out of it, not transformed but adjusted, smaller in some specific way, particular deflation of someone whose certainty has been clinically reduced. He said, "I should have listened to you about the blade." She looked at him. "That's it," he said. "That's what I wanted to say." It wasn't an apology exactly. It wasn't a reckoning. It was a man in his late 50s, with 30 years of surgical training acknowledging, in 5 words, that a floor nurse had been right about something clinical and he had been wrong, and the wrong had mattered. "Walter Doss went home 2 weeks ago," she said. "Full discharge." Greer nodded. He looked at the board for a moment, and then he went upstairs to his restricted practice and his remediation program and the long, unglamorous process of earning back something he had taken for granted. She went back to her patients. Aldrich Bowe called on a Thursday afternoon in January. She was on a lunch break, 15 minutes, an apple, the break room, and she almost didn't pick up because she didn't recognize the number, and unknown numbers had been complicated lately. But something made her answer. "It's Bowe," he said. "I know your voice," she said. "You sound different." Slept. A pause. Consistently. For the first time in about 3 years, he sounded almost surprised by it. "I'm working with a therapist. Sorrell's office connected me with someone who does S-level work." It's another pause. "It's a process, yeah. I testified last week. First round of the proceeding. How was it? Hard. Flat and honest. But it existed. When I left the room, it existed in a record somewhere. That's different from every other time I tried to say anything." He was quiet for a moment. Faro testified too. He's a pause. He's angry. Appropriately angry. He's also figuring out what to do with it. "He'll figure it out," she said. "He has time now." "Yeah." A pause. "I wanted to tell you something. The families. 4 soldiers from Karwan. I wrote letters to all 4 families. After the record correction went public, I didn't know if I should, and I asked the therapist, and she said it was my decision, and I decided I needed to. His voice was careful. 2 of them wrote back. She set down the apple. What did they say? One of them said, "Thank you." The other one said, "He stopped for a moment. She said she didn't know how to feel about it yet, but she wanted me to know she'd read it." He paused. "I think that's enough. I think both of those things are enough for right now." "I think so too. Are you going to write to them?" She had thought about it more than once in the specific way you think about things you know you have to do but aren't ready for yet. "Yes," she said. "When I figure out what to say, you'll figure it out." "Yeah." She picked the apple back up. "How's the apartment?" "New one. I have windows that face east. The morning light is good." He said it with the tentative tone of someone noticing something small and positive and not fully trusting the noticing yet. "Start. That's actually a lot," she said. "Maybe." A pause. "Mercer, thank you for the documentation, for the statement, for all of it. We both got it right the first time," she said. "We just needed someone to stop burying it." He was quiet for a moment, and the quiet had a specific texture, the kind that happens when something shifts into a place where it fits, finally, after a long time of being wrong-shaped. "Care of yourself," he said. "You too, Bo." She finished her apple and went back to the floor. Commander Declan Voss was discharged from the federal medical facility in late January. He sent her a message through Harmon, 3 sentences, practical and direct, which was consistent with who he was. He said his pulmonary function was at 78%, and the clinical team expected continued improvement. He said the proceeding was progressing, and her testimony had been central to the federal judge's evidentiary ruling. He said he owed her one, which she was fairly sure they both understood was not a debt that operated on a transactional basis, but that he'd said it anyway, because there wasn't another phrase that fit. Applied through Harmon. "Get the pulmonary rehab done properly. Don't skip sessions." Harmon forwarded it and added, "He says he won't." Put her phone away and went back to Bay 7. The hospital changed. The way institutions change when something expensive and uncomfortable has happened inside them, not quickly, not uniformly, not without resistance, but with the specific directionality of an organization that has seen the cost of its own blind spots and is slowly building something different. The HR contractor was gone. A new internal reporting system was implemented with a data security review built into its structure and external audit requirements written into the contract. It wasn't perfect. Nothing institutional is perfect. But it was better, and better mattered. The Nursing Council, which had existed nominally for years and had done very little, was reconstituted with actual authority over clinical practice concerns. Sloan was asked to serve on it. She agreed, on the condition that it had a direct line to the chief's office and a written mandate that clinical concerns raised by nursing staff be documented and formally responded to within a defined time frame. Professionally, Weatherton agreed to the conditions without argument, which told her that the previous 3 months had changed something real in how he understood the building he ran. She served on the council. She went to the meetings, which were sometimes tedious and sometimes contentious, and occasionally produced something that genuinely improved a system or a policy or a procedure. She contributed specific, practical input and did not contribute more than was useful, because she had neither the time nor the temperament for performing institutional engagement. Priya was elected chair of the council, which was the right outcome. Priya had the particular combination of clinical credibility and diplomatic persistence that the role needed, and she attacked it with the focused energy of someone who had been waiting for the room to be real for a long time. "You could have been chair," Priya told her after the vote. "I'd rather do the actual work," Sloan said. "That's why you should have been chair." "That's why you should be chair," Sloan said, and went back to the ER. The federal proceeding moved through its phases over the spring, and Sloan testified twice more, once via secure video link and once in person at a federal courthouse that was 3 hours from Doral Springs and looked like every federal courthouse she'd ever seen, which was the specific institutional architecture of a place designed to communicate permanence. She wore the same thing both times: dark slacks, a gray shirt, no jewelry. Not because she was making a statement about appearance, but because those were the clothes she owned that fit the setting, and she wasn't going to perform anything for an occasion that required her to be accurate rather than impressive. She testified accurately. She answered every question she was asked, and did not answer questions she wasn't asked. And when the opposing counsel representing one of the three officials attempted to use her undisclosed military background as a basis for questioning her credibility, she said, "My nursing license is current. My clinical documentation from the events in question has been authenticated by the Federal Medical Records Office. My testimony about the events I witnessed and participated in is consistent and corroborated by multiple independent sources. My military background is the reason my clinical assessments were accurate, not a reason to discount them." The opposing counsel moved on. The federal judge, who was 63 and had heard approximately everything in her career and was not visibly impressed by most of it, looked at Sloan over the top of her reading glasses with an expression that contained something the opposite of dismissal. All three officials were convicted. The convictions were announced in April on a Tuesday, which was unremarkable except that Sloan happened to be working a Tuesday night shift when her phone buzzed with the news alert, and she read it standing at the nurse's station between a medication reconciliation and a patient discharge. And she finished both before she let herself sit for a moment in the break room and do nothing. The sentences varied. The most senior official received the longest 12 years, eligible for parole after 8. The other two received sentences in the 7 to 9 year range. The sentencing judge's statement was specific and public and used the words deliberate concealment and abuse of institutional authority and catastrophic harm to the individuals whose records were altered in a way that would live in the official record permanently. Aldis received 16 years, no parole eligibility for the first 10. His sentencing was the one she allowed herself to feel something about. Though she sat with the something for a while before she understood what it was. Not triumph, she had checked herself for triumph and found mostly the particular exhaustion of a thing finally being over. Not forgiveness either, which she didn't feel obligated to perform for herself or for anyone watching. What she felt was closer to, the record is correct now. The account that existed in the world was the accurate one. Back. The 4 people who died in that valley had a true cause of death in the official file. The people responsible for that cause were in federal custody with their names on the public record, attached to the outcome. It wasn't everything. It never would be everything. But it was true, and it was permanent, and it was enough to build from. On a Wednesday in May, 6 months after the night Declan Voss came through the ambulance bay doors, Sloan Mercer worked a day shift that was entirely ordinary. Medium patient load. 2 minor traumas, one of which was a kid who had fallen off a bike and was more scared than hurt, and she spent longer than strictly necessary talking to him while she cleaned the road rash on his forearm, because he was 8 and frightened, and his mother was frightened, and that was part of what the job was. 1 complicated medication interaction that required 3 calls to the on-call pharmacist, and a patient education conversation that she had to simplify 4 times before it landed. A patient who was rude to her in the morning and then apologized in the afternoon, which she accepted without ceremony. Because people who are sick and scared say things they don't mean, and the apology was genuine, and it didn't need to be bigger than it was. She did the documentation. She answered questions from 2 newer nurses, one about a clinical assessment technique, One about how to document a patient's refusal of treatment in a way that protected both the patient and the nurse, and she gave both answers carefully and without making either nurse feel small for asking. She ate lunch. She drank bad coffee. She had a disagreement with Marcus Webb about the patient flow protocol in Fast Track that didn't resolve, and they agreed to bring it to the council, which was how disagreements about patient flow protocol were supposed to resolve. Normal day, unremarkable. The kind of day that used to be the whole of what she was building here and was now one day inside a larger thing that had changed shape. She was doing end-of-shift documentation at 3:45 p.m. when one of the new residents, a second year named Dr. Tamsin Okafor, sharp and earnest and still working out the boundary between confidence and overcorrection, appeared at the workstation with a question. Patient in Bay 5, Tamsin said. 60-year-old male, presenting with chest pain and diaphoresis. EKG shows ST elevation in 2-3 leads. I've ordered the cath lab activation. Is there anything? She stopped herself. I'm doing this right? Sloan looked at the chart Tamsin had pulled up. Read it. Read it again. Troponin pending? Just ordered. Good. The cath lab activation is correct. Did you get the aspirin in? First thing. Heparin? On the order. Okay. She handed the tablet back. You're doing it right, Tamsin exhaled. He's frightened. I told him what I think it is and what we're doing, and I think he's frightened. You should be, Sloan said. It's a frightening thing. She paused. But he came in when he felt it. That's the most important thing he did today. Tell him that. Tamsin looked at her. Really? People who have heart attacks and don't survive them are often the ones who talk themselves out of coming in. Came in. That decision is the reason we have the next hour to work with. She looked at the bay. Tell him. It'll help. Tamsin went back to Bay 5. Sloan finished her documentation. At 4:05 p.m., Tamsin reappeared. Cried a little when I told him that, she said. Is that normal? Sloan said. Good. Even. People hold a lot in when they're scared. Letting it out is better. The cath lab team arrived. The patient in Bay 5 was moved. Tamsin went with them, watching, learning, doing the thing she'd come here to do. Sloan finished the shift. She was in the locker room changing when Priya came in. Long day, Priya said. Average day, average for you. Priya sat on the bench and looked at her with the expression of someone who has been choosing the right moment for a conversation and has decided this is it. I want to ask you something, and I want an actual answer. Sloan looked at her. Okay, are you staying? She didn't answer immediately because the question deserved a real answer and not the reflexive one. Dr. Karwan, she had chosen this place the way you choose something when the alternative is becoming a version of yourself. You don't recognize out of necessity, yes, but also out of something more deliberate than that. She had chosen a job that required her to be present, to be useful, to make decisions that mattered in the specific weight of a human body in front of her. She had chosen it because it was real, in the way she needed things to be real, and because the work didn't lie. The work still didn't lie. That hadn't changed. What had changed was that the thing she'd been running from had been addressed, but the version of herself she'd been keeping quiet had been spoken aloud in a federal proceeding and was now part of the official record, and she was still standing here in the same locker room in the same hospital wearing the same kind of scrubs she'd worn for 6 years, and the world had not ended. The ordinary and the complicated could coexist in the same building, in the same person, in the same shift. She had known this was true, and now she had evidence. Yes, she said, I'm staying. Priya nodded like that was the right answer, and she'd known it but wanted to hear it. Good, because the council meeting next week is going to be brutal, and I need someone who will tell me when I'm wrong. You'll be wrong about the fast-track protocol, Sloan said. I know. Tell me anyway. Priya stood up. Come on. I'll walk out with you. They walked out through the staff entrance, the same entrance that had been watched, 6 months ago by two men who expected to find a threat and found an empty doorway instead. The evening was warm, the kind of May evening that comes with the particular quality of light that changes everything it touches, and the parking lot looked the same as it always looked. And the hospital looked the same as it always looked. And somewhere inside it, a man who had come in frightened with chest pain was in a cath lab with a second-year resident watching and learning how to save him. Priya said something about the council meeting, and Sloan answered, and they walked to their cars and said, "Good night," and Sloan drove home. She made dinner. She ate it. She sat for a while without the television on, which she did sometimes, just letting the apartment be quiet around her. She thought about the 8 stitches in a man's eyebrow and the way he'd said my wife was right about the machine. She thought about Tamsin Okafor's face when the patient cried. She thought about Aldrich Bow and east-facing windows and morning light and what it meant to build something new from the ground of a place you thought had no ground left. She thought about 4 soldiers in a valley whose names were now in a corrected record. She thought about what it costs to keep doing a job that demands everything from you and gives you back something that isn't money or recognition or certainty, but is still, somehow, enough to keep showing up. She thought about the fact that she had kept showing up. Through 6 years of keeping quiet, through a night that rearranged everything, through a federal proceeding and a public record correction, and the slow and imperfect work of an institution trying to become less broken. She had kept showing up and doing the work correctly and documenting everything carefully. And that hadn't been nothing. It had been everything. Her phone buzzed, a text from an unsaved number that she recognized after a second as the latest one Harmon used. Thought you'd want to know. Faro just got his discharge upgraded. Official record corrected. He called me to say thanks. Told him to thank you instead. She looked at the message for a moment. Then she replied, "Tell him to get some sleep." She put her phone down and sat in the quiet apartment and thought about the next shift 2 days away, a Friday, probably a busy one, and felt the ordinary weight of a person who has work to do and knows how to do it and intends to keep doing it, which is not a triumphant feeling exactly, but is something more durable than triumph. It is, if you let it be, enough. The world is full of people who get dismissed, who get called just a nurse, just a technician, just the person who follows orders, just the one who documents, just the quiet one in the corner who notices things. The ones who are told, in 100 small and large ways, that their judgment doesn't count, their expertise doesn't matter, their voice belongs in a different room. Some of them go quiet and stay quiet. Some of them write everything down. Keep showing up. Do the work correctly even when no one is watching, because doing the work correctly when no one is watching is the only version that actually holds when everything else comes apart. Sloan Mercer had been both of those people. What she had learned slowly, at significant cost, in a hospital, in a valley, in a federal courthouse, was that the work of being the second kind of person never stops. There is no moment where you've finally proven yourself enough and can rest. There is no jury that delivers a permanent verdict. There is only the next shift, the next patient, the next decision, the next time someone younger and less experienced needs to see what it looks like when a person knows what they're doing and does it without apology. That was the work. She had known it all along. She just hadn't known how many people were watching.